let's quickly have a recap of what we did. And is there any question about the last session? Because we had a couple of role plays and then we had discussion about the style of communication. Any questions about the role play or afterthought? Anything? We discussed that case where the patient had come for an MRI and then somehow the machine broke and then this patient is aggressive and we tried to strike conversation with that. So any afterthoughts about it or any questions?
Ma'am, in spite of our best efforts, if we are not able to convince the patient or the patient team seem to be not convinced, so in that case, do we still need to go ahead and try to pacify him, or we just leave him like that? At some point of time, it happens saying that whatever efforts we put, but they don't budge or they don't come to a kind of a platform where they discuss with us.
So I think what we understand from the experience, usually when you have an approach of creating a win-win situation where you are trying to help the person, either you are talking or people who are observing the whole thing will try to intervene and try to help this person understand that probably you're not looking at situation in a more logical manner. So usually people who are around, they also come to your help. That also helps to handle the situation. Second thing is, in case if we have not been able to create a kind of a situation where the patient is satisfied or happy, then we really need to also look into the system. Are we failing somewhere in the system where we are not able to address their concerns? Because had you been in that position, then if you expected something and if that's not being fulfilled, that means there is some system failure where we need to really, see how we can, create situation where clients are maximally or most of the clients are happy. But then a lot of time you will come across a person who is just adamant and is not ready to listen. I completely agree with that. So there you will have to be really very smart in finding a kind of out of the box solution for that person. And we have also seen people compensating and overcompensating just to get rid of that person.
Yes, correct.
I would not even exclude that option to buy a peace of mind, but that cannot be the norm. And that should be used with great discern, because if I'm using it more often, then people would get to know that if you argue and bargain and if you push them, they are ready to give you discount and ready to give you free service. So don't make this as a norm. That should not be the trend. Then it would be people will always come up to you bargaining and pressurizing you to give in. So that approach should be only when there is no way out. But then I think a lot of introspection needs to be done. A lot of time we think I'm doing it right, but we need to understand, do others also see that I'm doing it right, or it's just me who's feeling I'm doing it right? That will give us a lot of idea about how we are, what we need to change. But you have to keep updating yourself with skills to deal with such adverse situations.
Yeah, it all starts with basic training from the ground level as to how they handle, and from the time they communicate, basically. From the time the call comes or the patient comes directly, it starts with that. As last time Mr. Mohan had told about the training part, which is very important. It starts with training, like everyone has to be trained in the same manner.
So most of the situations can actually be handled if you have trained staff, if you have qualified staff, if they know how to handle, if they know the frequently asked questions are going to be this and what is the way out, rather than dragging the issue and getting permission from higher ups and then giving them what they want. If you think that can be given, happily do that so that you can end it as early as possible and move on to the next task. That has to be the approach. So it's not like, dragging the issue and creating fuss and even, creating trouble for yourself, I would say, rather than just the patient. Yeah. Thank you for that question. Thank you. Good question. So continuing with the same discussion, today we are going to we'll try to cover as much as we can. So I wanted to give you an idea about the 4 communication styles that we all use in our personal and professional life. And trust me, if you are able to master the skill of assertion, most of the problems you will be able to handle very, very smartly, because you will not have to convince, but automatically your way of dealing would automatically do the job for you. So we'll talk about that at length. I'll be sharing a presentation. We will have a discussion around that presentation. That's one. Then I will be showing you 4 videos. It's like my home production I've done in my own clinic setup, just to give you an idea about the 4 approaches. That is passive communication, passive-aggressive communication, aggressive communication, and assertive communication. And you will be very clearly able to see a difference in the 4 approaches in that 1 or 2 minutes long video. So that will also give you an idea about how you need to change your style of handling situations, and what is at the back of your mind. Sometimes we are not even conscious of that. And once you'll become aware of that, you will start working on making your communication more assertive. Then we'll also have, I would want to at least have 2 role plays, but I think I will be over ambitious if I'm expecting to have 2 role plays, maybe 1 role play on uncooperative patient. And that will be around patient, wanting to go llama. That's one situation we often, come across. Then how do you handle that situation? We will have a role play on it, and then I will show you those 4 videos. So if we can have 2 role plays, that will be really nice. But if time does not permit, then at least 1 role play we will cover, where we will try to see how we have to strike, a balanced conversation with people who are not understanding our point of view and who act little uncooperative in those situations. So that's the plan of the day. Let me quickly share the presentation with you, if that's okay with all of you. Although I can see only 13 of you are there, but then let's not wait longer than this for them. Okay. So I hope all of you now have access to all your 4 scores. That is passive communication, passive-aggressive, aggressive, and assertive communication. I remember in the last class, Dr. Puneet Gupta said that he could not get all his 4 scores. So do you have your 4 scores now, or it is still pending? Dr. Puneet, if you may unmute your device and please let me know.
And is it the total the full thing that you sent me in the beginning?
That was in the last session. In the beginning of the last session, just a day before the last session, I had sent a questionnaire called communication style.
Yes, that I have. Yes.
Yeah. I mean, conflict resolution we may not cover today, but I sent you the questionnaire so that if you have any doubt, we can, make sure that you have your scoring done properly. If time permits, we will cover that. Otherwise, we'll cover that in the next class. That's an additional point that I sent. But your communication style scores, if all of you have, I would request you to put those scores in the chat box with a comma in between, because we will be discussing these scores today. So if you may quickly put your scores in the chat box, that will be really nice. Yeah. सर 22 नहीं हो सकता, 20 हाईएस्ट है. कहीं गलती लगी होगी टाइप करने में, या तो एरर.
Let me check it.
Please. Yeah. शिप्रा, आपने भी 3 स्कोर्स डाले हैं, so you will be having 4 scores actually. एक बारी चेक करो. Yeah, please check.
I don't remember. I don't remember it.
Shipra, I'm not able to hear you. I think आपके end पे कोई network issue है, तो I'm not able to hear very clearly. Yeah, I remember Mr. Mohan's scores. They were there. Yes, they are the same. It's okay, Shipra. Then I think you take that questionnaire once again, and then you will be able to know your scores. We'll have the discussion today, and you can look at your scores later and understand your communication style. Yeah, I think, Dr. Deepak, this is right now. 10, 9, 10, 18. I think this is what your scores were last time also. Then Mr. Vijay Kumar, I think maybe your scores are also the same, if I remember. Okay.
Actually,
Yeah, I
I
typed it by model 10, 8, 10, 20.
10.
10, 8, 10, 20.
Okay. 10, 8, 10, 20. Fine. That's okay. You can put in, yeah, 10, 10, 8, 10, 20. That's right. Yeah. Yes, Dr. Puneet, you were saying something.
We'll do the calculations again.
But have you taken the questionnaire?
Yes,
Again?
yes.
And have you done the calculation? It's just that total, and you have to keep this record with you.
I have
That's all.
taken a photograph of that, and it will be
Okay, that's okay. Then I would suggest that you, do it. And after the discussion, maybe you will have a greater idea about your styles of communication, and you will know the interpretation of those scores. So it's all right. It's okay now. So as I said, that we all have, different ways of handling situations where there is a conflict of interest or we don't match in our viewpoint. And that is where we really, adopt a way of handling a situation. So some of us actually, whenever we come across a situation when we cannot handle the disagreement, we actually withdraw from the situation. As a result, we actually, allow our rights to be violated by failing to express our honest feelings, because we feel if I will put forth my opinion, others might not respect it, others may not like it, they may see it as a arrogance, they may not really respect my opinion. So as a result, a lot of time we just take a quiet stand, especially when we are dealing with a person in authority. So there we feel that I cannot handle this person, so let me just keep quiet and not share my opinion. So once in a while, if I'm using it, it's perfectly all right. But then if it's my regular way of dealing, then problem is that I am not being honest with my feelings. So the goal of this kind of communication is that I'm trying to avoid conflict at the cost of my own feelings, thoughts, and comforts. So you would normally defer to others' opinion when you're using passive communication because you don't want to come out with your honest opinion. When the person in this kind of style would, interact with group or people, they would make very little eye contact. Usually their tone will be very low. They would speak at a very low speed and low volume because they are probably scared or inconfident, or they just want to, not make any communication at all. So as a result, they're just trying to be, to be very, very safe. So definitely this way of handling situation is quite safe because you are not coming out with your opinion, but at the same time, you are losing your own rights. Now, some of the examples that I can, share with you, which you will often see people using passive communication style, is that they'll often say, when you ask them, okay, what do you say? Very often you will get to hear, I don't know, I'm not sure, I don't think I've thought about it. So they will never come out with the honest thought process. Or they may even tell you, like, it's okay, whatever you think is all right. You know it better. I think you're more experienced. So you please decide on my behalf. So they will put the onus of decision on you or on others rather than taking the responsibility of sharing their thoughts. They may even say, okay, whatever everybody says, it's okay. I mean, in any meeting, you will never see them coming out with their, real thought process or feelings. As a result, you will also see that they will have a feeling, that inside feeling probably, that I don't care and it doesn't matter to me. So as a result, they would not, share. Even when it comes to asking for help, in case if they need help and they need to ask for help, you will see they will not come out in an honest manner and ask you for help. So even if they haven't done the work and you tell them, why didn't you ask me if you didn't understand? They'll give you an answer. I thought I'll work on it. I thought I'll understand. I think I'll sit and study. But they will never actually come out with the real reason that why they were not, comfortable asking for help. Also, whenever they, they want to say no, for example, if you give them some responsibility and they think they can't do it, they will never say you no, because they are too scared to displease people or to say no or to have another conflict situation. So they, at least on the face, they will say, okay, I will do. A lot of time people get burdened because of this, because then when they're given the responsibility, they don't say no, and then at the end they feel, burdened and troubled by the responsibility. So in certain situation, passivity is appropriate. For example, when the issues are minor, So if you decide not to speak, not to, really strongly hold a stand, it's okay. Because when you think it's not a very big thing, whatever others are saying, I'm okay with this, it's perfectly all right to take that approach. On the other side, when the results of pushing the issue is, it's going to cause more problem than give you the benefit, again, it's better to, keep quiet, because, you're not going to get anything in that market. It's better to let go. You have to actually weigh both these situations and see which is best for you in that situation. Also, when the power differential is too huge and it is not in your favor, in those situations also, it is sometimes all right to, take a passive stand, because you know that the person with whom you are, interacting is probably in a very powerful position, and you will not have any say and nobody will stand by you. So a lot of time we take that with a pinch of salt, and we just keep quiet in that situation to avoid further aggravation of the situation. Also, when you're dealing with people who are, in a position of power and position of, whose position is impossible to change, for example, law. So you know that this person, comes from either police or judiciary. So you cannot get into, a situation like this where you can fight with them and you can drag the issue beyond a point. So in those situations, I think taking that stand is still okay. But again, it doesn't have to be a regular way of dealing with the situation. Another way that we handle disagreement is passive aggression. And I think this is more common, where you will see people overtly will look very calm and agreeing with you. But actually, inside they are unhappy, dissatisfied, and they're cribbing. And most of us actually handle situations like this, especially when we know we cannot, take a stand or we cannot speak up. As a result, what happens? These people would be forfeiting their rights initially because they are not exercising their right, but it is not settled by just keeping quiet. It will be followed by manipulation and vengeance. So they'll go and talk ill about you or about the decision you took or the way you handled the situation. So the idea is, in this style, they will try to avoid conflict. And then they will want to make the other party feel that I wish you had asked me. I wish you had taken my advice. I wish you had included me. I wish you had seen the way I see. So, they want to put the blame on others by saying that you did not honor my rights or you did not allow me to exercise my rights. Usually these people would behave passively, but later aggressively when they are not around. So so when people, who have tendency to gossip or to talk ill or to criticize or to find fault with others, not when we are in this situation and we are discussing, but later on in the absence of the person, that is nothing but passive aggressive communication style. Often you will see them using sarcasm in their way of handling this situation. So if I may give you a couple of examples of passive aggressive communication, a lot of times they'll say, yes, sir, I will do. Don't worry. I will take care of this. But later on, very often they'll say, I'm really sorry, I forgot. I don't know how it slipped out of my mind. I had it in my list, but somehow I got busy. So that would be a very regular kind of a thing. Of course, we all forget once in a while, but usually if we have made a promise, we will keep in mind, oh, I'm supposed to be doing this. But very often they use this way to avoid responsibility and also not say no. Also, they'll also say so you are so good at it. You should be doing it. So that's not with an intent that actually they're appreciating your capability or your experience or your position, but basically they don't want to take the responsibility and also the onus of outcome. So they normally would put the onus of
webinar attend ಮಾಡ್ತಾರೆ ಹೇಳಿ ಪರವಾಗಿಲ್ಲ no please tell me no issues
sorry. Okay, so you will also see them, using sarcasm like this when they come across, something. They'll say, "Oh, great idea," but they're not actually genuinely appreciating, but they are being sarcastic. And whenever you will ask them to do something, they will usually change the situation. Now, if you look at this style, they are not being honest in expressing their opinion. but they don't hesitate criticizing or finding fault with your way of functioning. Another way of handling a situation, which we again very often see, is called active aggression. So people who quickly lose their control, you will see them, becoming loud in their way of communication, becoming aggressive, using foul ways of snubbing others. This would often happen with people who are in power position, because they know they enjoy that immunity where their staff or subordinates would not give them back, or they cannot harm them. So very often you will see people in power position, they can become prey to this, kind of a way of handling situation, because they believe leadership or power position is parallel to being aggressive and being rude to people. So people who use aggressive communication, they would actually communicate in a manner that they want to win at all cost and to be always right. So there's an automatic assumption that what I'm saying is right, and that is what everybody has to agree. Also, they will protect their rights, but at the same time, they would actually dishonor the rights of others. So they may protect their rights at the expense of others' rights. Also, a lot of time, they do not consider the consequences of an action. See, we all work in a team. So if you cannot take your team with you, trust me, and if that's my way of handling situation, later on when I need my team to participate or contribute to give their best, they will never be forthcoming. As a result, actually you will be losing a relationship and a team, team members. These people would often use very aggressive and angry body language, which is like having the facial expressions of anger, intimidation, rudeness, authority, and even their eye contact would be aggressive. They will never defer to others. They'll always try to control the situation and make sure what they say is being the final word in the situation. Also, they will use a lot of energy, because when you become aggressive and angry and you do use this way of communicating, you are likely to use a lot of energy, and you will be loud and belittling others. Violence and verbal abuse can also be one of the ways they will be showing their aggressive communication. Now, if I may share some of the examples of aggressive communication, very often you will see them saying, I don't know why you can't see. This is the best way to do it. Or if they have been in system for years together, they'll say, what you know about this place? You have no idea. I'm here for the last 5 years. I know each and everything about it. So they'll try to actually dominate through their experience or expertise in this subject. Can't you see that this will not work? Again, it's like embarrassing and humiliating the other person. I don't care what you feel. So that means your feelings, your thought process are not as important as mine. And also just do the way I'm saying, or just do what I say. So that means you're supposed to be following my orders and not arguing or asking, questions about it. So, I'm sure this kind of behavior, directly or indirectly, you may be seeing among people who are aggressive in their communication. So aggressive communicators actually need to consider some of the things. For example, when you are attacking your team or your people by calling them name or accusation, you're going to actually shut down all productive communication with your team, because they will hesitate to share their thoughts. They'll try to avoid discussing their honest feelings or thought process, especially if they differ with you on any issue. They will avoid any kind of, discussion, because, ultimately after the discussion also, they will have to agree with your point of view. So they'll say, why waste time? Just quietly agree with what you say. So whenever you are tempted to attack your team or people with whom you are working, please remember that you're going to actually lose a good relationship in that bargain. You may win an argument, but you will lose a friend or an employee or a team. And a lot of time we have seen people do not change their companies. They change their bosses. Especially as a boss, if I am aggressive, my staff, my team member would be unhappy to stay with me. So before you actually react to any situation in an aggressive manner, give yourself a minute before you actually say what you are going to say. Think about the consequences. So some of the ways I would recommend, like I'm sure you all must be doing it, when we say take deep breath or take, a few sips of water, or maybe physically move out of that situation before you take a call or before you, respond to this situation. So all these things are actually suggested with the idea to bring calmness for a couple of seconds. The moment you will calm down, your rational mind will come in place, and it will provide you a better way of communicating your thoughts in a less offensive manner. So I think people should learn to compromise, because not always what we say or what we think is right. It's always group wisdom that works better than individual you know so if I may ask you the advantages and disadvantages of all three. So for example, if a person is using passive communication style, if you could write in the chat box, what do you think are the disadvantages of using passive communication style? Please write in the chat box. I'll take up this question, Dr. Puneet. So people will not take you seriously. Absolutely. If you are not expressing your thoughts, Mr. Vanchi, you're right. People will never respect your, they will not take you seriously. Yes, Mr. Mohan, conflict will remain unresolved because you may be apparently quiet, but you're not giving your 100%. So there will be unresolved conflict. Losing the opportunity to express, yes, I think that's an important thing. Where is your growth? Where is your say? Where is your opinion? Where is your point of view? It gets completely crushed in that process. Then, of course, very right, Dr. Deepak, you said your views will never be known to others. Absolutely. You may have a wonderful idea, but because you are scared to showcase, you're scared to put it forth, people will never get to know. Oh, yes, time bomb. Yes. Actually, passive communication ultimately ends up into passive aggressive, and passive aggressive would end up into aggressive. So automatically, yes, you're right. It's a time bomb. It's just waiting for it to get filled to go to the extent of actually erupting as a time bomb or a volcano. Yes, Shipra says people don't speak up even yes, if people who don't, I mean, not that who don't speak, they are not right. Usually people don't speak, but they are right, but they are too scared to tell that I am right and you are wrong. I agree with you. Okay. You will be ignored. Yes, I agree. You will be ignored. Actually, people will walk over you. It's not just being ignored. People will take you for granted. You will always get the leftover. You will never be given your share of credit or acknowledgement or your share of happiness. Ideas will be lost, definitely. Team loses your contribution, absolutely. Then at one time they will just explode. Yes, yeah, I understand. Yeah, ideas and thoughts remain untold. I believe absolutely, Madhi, I agree with you. Lack of knowledge may cause this. Yes, and thought, though you have ideas, it would be missed opportunity to showcase your persuasive skill. Yes, not only persuasive skills, you will have a lot of other skills within you which need to be used and exercised and displayed, but then you will lose it just because you are taking a passive stand. So those of us who often take this as a regular way of handling situation, be aware. It's not just that the organization will lose, but your growth opportunities also would be affected. So you have to learn to put across your ideas in the right manner, and we will talk about it. So a lot of us actually avoid this because we also feel that I will lose control or I will immediately become aggressive. So it's better not to pick that. So that means I really need to learn how to put my ideas and thoughts in the right manner, and I don't lose my control and composure and still express myself. And we'll be talking about that in a while. I absolutely agree. It also reflects on team leader. Absolutely. I think that's very important, Dr. Deepak, what you're saying. As a team leader, I think, like, for example, those of you who are even practicing clinicians, You have your residents working under you, you have your nurses working under you, you have your technicians working under you. So creating an environment of mutual respect is very important. So therefore, if your approach is aggressive, please remember you are more likely to have team members who are either passive or passive aggressive. Because even assertion you are going to view as aggression. Since you are not in habit of listening to other person's point of view, you will have difficulty accepting a person who comes and expresses himself or herself in an honest manner. So that's the disadvantage of using aggression as a team leader. I completely agree. So if I may ask you to put your thoughts in the chat box about the and also not just that, when I'm using passive communication as my primary way of handling situations in life, not only my rights get forfeited, what about my mental health? Will I be happy? Will I be satisfied? Will I really enjoy life? Will I have pleasure? Will I carry any happiness home? And a lot of time when we are unhappy at a workplace, we take out that anger on our family, friends, soft targets. That's also another disadvantage. And also it actually breaks down your not only self-confidence, self-esteem, self-image, self-concept. Everything gets affected when you are not asserting in a situation. Absolutely, Shipra, no happiness. There's a lot of dissatisfaction and loss of mental peace. A lot of mental health issues also can pop in, like anxiety and depression. They can definitely pop in. Absolutely. If I may ask you to share your thoughts on what are the disadvantages of using passive-aggressive communication style? What would you say? Write in the chat box. Yes, Dr. Deepak, I agree. It depends on the person's expectations. Some are just happy to pass time. So as a team leader, again, we will be talking about it in one of the sessions. How do I really create an environment where I ignite minds? Because everybody has a potential. As a team leader, it's my responsibility to ignite mind and also involve them. Maybe in one of the sessions, we'll be talking about that. Although that's out of the preview of this program, but then we'll bring that up. Yeah, if you may please write your thoughts about disadvantages of using passive-aggressive communication style. I'm waiting for everyone to finish writing so that we can quickly read through the answers given by you. In passive-aggressive, Dr. Seema, you will never be taken for granted. If anybody uses passive-aggressive style, people know that you are a passive-aggressive person. In your team, you will always be you will be able to identify black sheep. People who would not speak upfront, but they'll go and do backbiting. So you are not taken for granted, but you are always, people will be on guard with you. They will not trust you because they know you are going to speak something ill, not in front, but in my back. So that's the thing. Others take advantage of you? No, others cannot take advantage of you. Rather, you are, not acting right if you are using passive-aggressive style. Because others know that they are at risk. You are going to talk ill about them. So they will not take in passive communication, you can be, exploited. In passive aggressive, you are not exploited, but rather you create a situation where it is, a situation of distress and uncomfort. People will not open or comfortable with you. Yeah, they may not trust you. I think if that's what you're trying to say, Dr. Puneet, they will not trust you because they know that you will not come out honestly with your real thoughts. Apparently you'll say, yes, a great idea. And at the back, they may say, what a useless idea he was offering. I agree with you because they know that you're not going to be honest in your expression. Yes, people perceive as inconsistent. Yes, Mr. Vijay, I agree with you. You will not be, trusted by people. And people know that you will not come out with your honest thought process. Dr. Deepak Singla says conflicts, lost team spirit, poor decision making, digressing. Yes, that I agree, because team will never be able to function with full strength. There will be people just to pull down or take the energy away. So I agree with you. Unnecessary conflicts at a later stage, yes, will be perceived as not being a team player. Yes, you will be actually identified as a spoiler, and then people then consider you not a leader but as a boss, a dominating person, wrong decision making. Sometimes people will do buttering, and then one time you'll be kicked off from the organization. I don't know, but I think if you are a passive aggressive leader, I think team is in a difficult situation, because they will never be able to clearly know what is expected from them. They will never be able to, give you 100%, because they will always find you dissatisfied with the way they function. Okay, one loses real issues, absolutely. And then result is it increases employee turnover, loss. Yes. If you are a leader, if you are a passive aggressive leader, even then you are unlikely to have good people working under you, and it causes conflict. I agree with you, Azad. I think that's a very common problem. People don't speak up, but then there'll be underlying conflicts, unresolved conflicts that will solve. Now, if I may ask you to share your thoughts about people who are aggressive, what is the disadvantage of using that as your primary way of handling a situation? If you are an aggressive communicator in most of your situations, what is the disadvantage of this style? Hypertension. Yes, no win-win situation. Absolutely. Mental stress for self and for others also. Absolutely. People will not, yes, I think I agree with you, Mr. Vanshi, very clearly. People will never feel comfortable because they fear your anger, your unpredictability, your aggressiveness, burnout for all, frustration for all. I think that's what I would say. Subordinates will not open up. Absolutely. Because people will fear that if I do not agree with my boss will not like me, and I will be in the bad books of my. Yes, people will slowly stop communicating, and actually they will leave you and go. There's a possibility that people will leave you and actually go out of the situation. I don't know if I shared with all of you a recent incident that has happened in my own life. Is my would-be son-in-law, who is a lawyer, and he's working with a tier 1 law firm. He got selected in another tier 1 law firm, which is extremely reputed law firm, and at a very, very good salary. He almost, like, for 4-5 months they were meeting and contacting and discussing, and finally he joined this new firm. And within 1 month he came up to me, of course on phone we were discussing all this. He said, I'm experiencing extreme anxiety because the person who is my boss is extremely aggressive. If I go to him discussing anything, he shouts not only at me, on everybody. He humiliates, embarrasses, slaps people and whatnot. He said, I am going to leave this job even if I don't get a next job immediately. I would rather stay at home and lose my peace of mind. Fortunately, the company that he had left, they were still looking for his replacement, and they were not able to find a good substitute. They offered him to come back at the same salary that he was drawing in the new firm. He was lucky to be able to go back. Otherwise, I'm sure he would have experienced extreme mental health concerns if he had continued with this company. Yes, I agree. Can one change his behavior consciously, passive or aggressive? Yes, I think that's what we are going to talk about. It is not a personality trait. It's not a personality trait. It's just that we don't know the way we are handling situation. Once you will get to know the alternatives, and once you will know the flip side of each style, you will become conscious of not using those styles. Because see, we think leader or in charge or boss means aggressive. This is a wrong connection we already have in our mind. The moment you'll get to know this connection is unhelpful, is unproductive, is actually, destructive, you will quickly leave it. It's only a matter of becoming aware. So if you remember the 4 stages of learning that we discussed, the first stage is unconscious incompetence. The stage where we didn't know that the style I am using is detrimental. It's not helpful. It is rather harmful. That is unconscious incompetence. The second stage of learning is conscious incompetence. Now we are discussing the different styles. So I know each one of us is learning, okay, this style has this disadvantage. Therefore, I made you all write this, because we all invariably are using these styles alternatively. So once you will know the disadvantages or the harms of using this style, we are becoming aware, okay, this style has this disadvantage. So that is conscious incompetence. The third stage of learning is conscious competence, where you will make efforts to bring in new styles of handling situations, which require effort. Definitely, I don't, disagree. But at the same time, if this has come to your conscious mind, I'm sure this is going to stay with you. It will take time where you will actually put in little effort, sit back, even if you have not behaved appropriately, sit back with yourself, reflect on the situation, look at the way you handled it, not what the other person did. We have no control on the other person's behavior. But when you sit back and look at your behavior and you see, okay, this is what I said, and completely, the discussion turned into an argument, or discussion turned into an aggressive reaction. So that means this was not right. Then the second question you're going to ask yourself is, how else could have I said this? Your unconscious mind will give you answers. And then you will be better equipped to deal with this similar situation next time. So slowly there will be a change. There will be a shift where you will be moving from passive or passive-aggressive or aggressive style to assertive style. And then the fourth and the final stage of learning, that is unconscious competence, where the right way of dealing a situation will become the only option on your conscious mind. Either you will do it in that way, or you'll say, hold on, I'm not going to do it, I need little time. But you will not fall on the other side. And that will become part of your personality. That will become an integral part of your way of handling life. And it's not just in professional setup, even in your personal life, when you're dealing with your children, with your spouses, with your relatives, this is the way you will be handling them. And that's the fourth and the final stage of learning. Learning assertion is difficult, but it's very fruitful. It's very helpful. It's the way to happiness. It's the way to contentment. It's the way to change the direction of your life. And I'm going to talk shortly about how do we really assert and how do you start implementing. Slowly, things will change. You will see the result. You will see it helpful. That's the idea about using assertion as the right way of dealing. Yes, Dr. Deepak, I think you want to say something. Please go.
I think if we can just try to remember these 4 stages just by remembering the days we learned car driving.
Absolutely.
Like initially we are unconsciously incompetent, and then gradually we drive it without even knowing what we are doing.
Absolutely. Very beautiful example. Driving, swimming, these are the things we first learn with a lot of effort. First, we don't know. We become aware, we don't know. We learn a lot of effort we put in, even driving. I mean, pressing the clutch, then accelerator, then changing the gear, using the brake. I think we are conscious. And if somebody tries to talk to us, we'll say, don't speak, let me drive, let me drive, let me drive. And a day comes when we are talking on phone and we are driving and we don't even realize when we change the gear from first to second and second to third, and then we reach home. We don't even care for the direction. We don't even know when I took left and when I took right, and you are home. So that means that whole thing has become part of your autopilot mode. That's the final stage of learning, unconscious incompetence. So let me quickly take you to the skills that I would recommend to each one of you to start implementing as early as possible. And let me tell you, you're already doing it, because this course that you have attained, they show that you're already using it. But now you will do it consciously, and you will know what more I need to integrate in my approach. So if I may talk about the assertion as a, okay, this is just a last slide. So in certain situations, aggression is overlooked. For example, if it's an emergency or crisis situation, if you become aggressive, people will tolerate it. It's okay, it's an emergency situation. Or when there is no time for discussion or explanation or assert, people will still be okay. That's okay. You did not talk to me properly, you did not share with me, they will not mind. But otherwise, if you are using aggression as a regular way of dealing, people are going to move away from you. And when you're the only one who can save the situation, people will still take you with a pinch of salt that, okay, let us, overlook the aggression, but let the work done. But again, as a long-term, leader, as a long-term team leader, you will not be, tolerated. So if you look at 3 approaches, you will see this often in your workplace, and I think you'll be able to even identify people and even introspect in your way of handling situation. See, people who are passive, you will see them chronically late for everything, be it a meeting, be it a responsibility. Give them a call, either they will not receive it, or if they will, even if they have seen the call, they will not return you the call, because they know they don't want to interact, or they don't want to discuss with you. Most of the times their work will be incomplete, so you will see the quality of work will not be really up to the mark. More so with the idea that they should not be given responsibility, or they should not be included in the thing. So their work and their quality of work will not be optimal. If you ask them to come for a meeting, either in a group or individual meeting, they will usually avoid. They'll try to give you some or the other reason. Even if they come, they will not participate. They'll just stay quiet. They'll take a back seat. They'll be busy doing something. They will not, come out with their opinion. And even if you give them a responsibility, you will find them ill-prepared or not prepared for the responsibility. So they'll do minimum what is required to be done. You will not see any proactive approach in their way of taking responsibility. Now, if we look at people who are using passive aggressive style, a lot of time you will see them passing hostile notes and emails. Later on, they'll also pass derogatory comments about people, about their bosses, about institution, about each other. They won't hesitate joking inappropriately and even making sexual comments or harassment. Often you will see them, complaining or blaming others for their failure, for their not being able to achieve or not being able to do enough. People who are aggressive, they are more likely to use inappropriate anger and threat in their communication. The moment their point of view is not accepted, they'll either use anger or they'll threaten the person. Often you will see them yelling, publicly degrading their team members. So people who are in habit of shouting at their residents, nurses, technicians, especially in a public place, in front of patients, in front of other staff members, they are using aggressive approach. And we have seen people, pushing and throwing objects. I think even in OT, we have seen surgeons throwing an instrument, shouting at nurse, you don't know which instrument is to be given, who taught you to, this and that. And even with their residents, they will, you don't know how to suture, who taught you to this. So that means they would actually throw their weight on others, using tantrums in front of others. Outburst of anger, physical abuse, swearing are very common among people who have an aggressive way of handling situation. So if you are using any of these, please restrain, please stop, please control, please avoid. This is what I'll say. I don't mind if you want to take a screenshot of this. Of course, I will be sharing the YouTube video with you, so you will have a record, but take this, the screenshot of this. If you are doing anything, any one of the things, please do not do this, because ultimately this is not a healthy way of handling any conflict. So if I may share what is the right way of doing it, it is nothing but assertion. So a lot of time we say people are difficult. Very honestly, people only they appear difficult because we do not have the skills to handle them. The moment you will have the right skill to handle difficult people, the situation will look very, very easy to you. And in those situations, assertive communication skills play a very, very handy role. So even when we are caught in a difficult situation, you will see one of us will emerge to the situation, will be able to effectively handle that situation. That means that person has better skills than us to deal with difficult situation. And very often you will see them using assertive skills in their communication. Now, if I may ask you, what are assertive skills? If you write in the chat box, that will be really great. What do you understand by assertive skills? Soft but firm, absolutely, always progressive. To ensure viewpoint is communicated respectfully, yes, very true. Polite, teamwork, clear communication of your thoughts and ideas, absolutely, I agree. Reacting in a controlled manner, okay. Backed with logic, yes. Positive communication, absolutely. Mutual acceptance, wonderful. Ensures that the team agrees and understands, okay. To respect others' opinion, wonderful. I think, Hamid, that's a wonderful thought. Needs and wants are clearly communicated, yes, I agree. Dogmatic and persuasive approach, again, I agree. Repeat what you said, but in a balanced tone. Wonderful. Balanced communication, again, a very right thought. Takes everyone's opinion, absolutely. Especially when you are in team, you value others' opinion. I agree with you, Mr. Vanshi. I think wonderful answers you have all given. So that means, if I may put everything that you have said, if you have these 5 qualities in your communication, you can say your communication is assertion. So what are these 5 qualities? When you express yourself openly, honestly, positively, confidently, and respectfully. When you are able to say everything in this manner, you can believe that your communication is assertion. Of course, I'm going to discuss a couple more aspects of assertion, but this is one of the parameters you can keep in mind. Am I being open? Am I honest? Am I positive? Am I confident? Am I respectful towards others? More or less, your communication is going to be assertive. So when you assert, you not only protect your rights, but you protect others' rights also. So in aggression, you are obsessed with your rights or your needs. In passive, you are respecting others' needs and rights, but you don't care for yourself. In assertion, you are using both the aspects of needs, yours as well as. So in assertive communication, you protect your rights without violating the rights of others. The goal of this kind of communication is to communicate with respect and also understand others' point of view. So when you express yourself and when you listen to the other person, and in case if you find the other person's point of view is more valid than yours or is more useful than yours, in assertive communication, you will not hesitate saying, I think I agree with your point of view. What you're saying makes more sense. Let's go by what you are saying rather than what I am saying. So that is the actual form of assertive communication, where you are actually trying to find a solution to the problem and not just pushing your opinion or your decision. So you are thriving to create a win-win situation where you express your thoughts and then you listen to the other's point of view, and then you choose the style that would work for everybody. So people who are using assertive communication, often you will see them maintaining eye contact because they are looking at you. They are maintaining eye contact by communicating. They wish to communicate that what I'm saying, I'm speaking out of a lot of conviction. But then again, their eye contact will not express intimidation, anger, aggression, or any kind of insult or injury to others. Eye contact is firm and friendly. Then also they will present their wishes clearly and respectfully. They will not say, I don't agree with you. They'll say, I think I agree with your point of view, but I have another idea. Can we consider this? So I am not being disrespectful to what you're saying, but I want to tell you that I have a different opinion about this same thing. They will be very strong, confident, yet flexible. So if you remember in the last session, I made a mention that there was a time that we actually valued IQ. We said, okay, people with high IQ means they are the best to be, associated with. Then came an era when people said, it's not just the IQ, it's also the EQ, that is emotional quotient. Okay, now EQ is also being valued, that people who have, sense of dealing with people, handling team. The third quotient now that is being valued very highly, for any kind of situation or for a leader, that's called AQ. Any idea what is AQ?
Agility quotient.
Absolutely, agility quotient. Your flexibility. I think COVID has taught us people who were flexible, they remain afloat. Others went down. So I think that's one area we need to really, really work on, because we never thought that being at this position, being in this age, being in this role, I have to be flexible. So if you're a parent, if you're a teacher, if you're a clinician, if you're a manager, if you're heading any organization, flexibility is what is going to get you more from your team, rather than, being strict and adamant on your stand. So people who are assertive, they are strong, they are confident, but they are equally flexible and open to the other's idea. So their approach will be very objective, not that my way or highway. They'll say, okay, this is my opinion, what do you say? And if they get to have an opposite opinion, they will not get overwhelmed, but rather they will explore that with the idea that maybe this has a better opportunity or a better option. So they will listen others, they will validate others, and then, they would try to find a way that would work for everyone. So if I may share some of the examples of assertive communication, very often you will see them saying, I can see that this is very important to you, and it's very important to me as well. Perhaps we can talk more respectfully and try to solve this problem. Or not exactly in these words, they will say, I think I agree with you, but let's sit and talk. I think we need to talk about it. So what they are trying to say, create a place where we can exchange our thoughts and exchange our ideas. Also, very often they will use the word I think, I feel, I believe. Because when you own an idea, when you own a feeling, when you own a belief, that shows the conviction that you have in that idea. People start taking you seriously, that, okay, if you're saying this, that means you are really serious about it. When they ask for others' opinion, or even if they are interacting with people who are not agreeing with them, they would not say, tell me what do you want. They would actually respectfully ask people to open up by saying, I would appreciate if you share your thoughts about it. Even if you don't agree with me, it's all right. Maybe your opinion will have a different perspective. So they will very respectfully make people open up with their thoughts. Or when they have to say no, they will not straight away come up and say, no, I can't do it. Rather, their approach will be, for example, I'm working on something very urgent. Is it okay if I help you after I'm done with this task at home? So that means they're not saying no for the sake of saying no, but they're saying no because they're busy with something and they're ready to take this task after they're done with what they're doing. And even something like, I have stayed late 3 times in this week. Can we take this tomorrow? So again, they are giving a reasonable reason for saying no, which would be normally accepted by the other person as a very logical way of saying no. So in their saying no also, there will be a lot of respect and desire to stay connected with the other person. So if I may, summarize the 4 styles of communication, and this will give you again a great insight. You can take a screenshot if you want about it, and I'll just explain about this. Passive communicator will be emotionally dishonest because they are not respecting their own emotional need. In their approach, they will be indirect because they are not directly addressing the issue. They will stay inhibited because they are not expressing themselves in an honest way. They are self-denying because they're denying their own thoughts and feelings, the true, open expression. They would usually take a blaming and apologetic stand. So usually either they'll blame others or self for the situation and will be over apologetic for no reason. People who are using passive aggressive style, again, they are emotionally dishonest because you are not respecting your emotional milieu, or you're not coming out with an honest emotional expression. Again, they will take indirect approach because they are not addressing the issue in a direct manner. They are self-denying at first and self-enhancing at expense of others later, because they tend to criticize and find fault with others. People who are aggressive, they are inappropriately honest. So that means a lot of us who think that I am being honest and direct and expressive, I'm sorry if that's hurtful to others. That's not assertion, that is aggression. A lot of people, they say that I'm very assertive. I just say what I have to say when I want to express something. I don't care if others, don't agree with me. That's perfectly all right. But is that hurtful? Is that insulting? Is that closing people? Then it is not aggression. So if you can remember those 5 points, is it respectful? Is it open, honest, positive, and confident? Only then it is assertion. So people who use inappropriate honesty and they think it is assertion, it is not. It is actually aggression. They will be very direct, very expressive, rather attacking and blaming, controlling, and self-enhancing at the expense of others. But people who use assertion, they are appropriately honest. They will come out with the facts in an honest manner, but at the same time, they will be respectful and kind to others. They'll be direct, self-enhancing, expressive, self-confident, at the same time, empathic to the emotions of all involved. So hurt, insult, anger will not be part of their communication. So if I may put 2 major qualities that needs to be considered, one is clarity of communication and second is consideration for others. People who are assertive, they will actually have the highest quality of clarity of communication. At the same time, they will be high on consideration for others. And all 3 would be at a different position. For example, people who are low on clarity and low on consideration, they would usually be using manipulation. They will certainly make sure that my rights are looked after and they prevail. People who are passive, for them, their consideration for others is very high, but consideration for self is low, so therefore they will not communicate effectively. People who are aggressive, their clarity of communication will be very high, but their consideration for others will be low and poor. So if you look at this grid, this is the concept given by Eric Berne, who talks about transactional analysis. We all take different, stand in our life, and we try to create win-win, different combinations of situations. So people who assert, they try to create a situation of win-win. That means I win and you also win. People who use aggressive approach, they say I win, I don't care whether you win or you lose. People who use passive approach, they wouldn't mind losing to make others win. And people who use passive aggressive approach, ultimately they lose and they make others also lose. So that's the disadvantage of using passive aggressive in any relationship. This is again, assertive people will have a win-win kind of a situation. Yes, this is again the concept given by Eric Berne, who talks about transaction analysis. Eric Berne, I know, I hope you know, he was a very famous psychiatrist who wrote a couple of beautiful books on how we all, interact with people, especially the social games he talks about. And there's a book called I Am Okay, You Are Okay, and Games People Play. These are 2 very beautiful books by Eric Berne, and they'll give you a great insight into the kind of games we all play with each other, knowingly and unknowingly. So people who take this stand of being a passive communicator, they actually have a stand or approach where they believe, I am not okay, you are okay. So they assume, they put the other person at a higher pedestal. So as a result, they always considered themselves incompetent, less in experience, less in knowledge, less in ability. People who use passive aggressive, they think I am not okay and you are also not okay. And people who use aggressive approach, they always move with the idea, I am always okay, but you are not okay. But people who use assertive approach, they would use, I am okay and you are also okay from your point of view, which is considered as a healthy approach. So people who use assertion, they will have a high consideration for others. Also, they will actually use the best communication, they'll have clarity of communication. So if I may quickly give you a couple of examples of how we can actually, use the right assertive communication style. So if there's a situation when somebody is interrupting us, and even if you are, lower in position, instead of saying, you never let me complete, suppose if it's your boss who has interrupted you, or somebody senior who has interrupted you, or a colleague who has interrupted you, instead of saying, you never let me complete, can you suggest some other way where you can actually communicate the same thing, but in an assertive manner? So it's more like an activity I'm giving. You can unmute and speak.
Well, we can always say, sir, can you just allow me to complete? Give me 1 minute, and then I will definitely, we both can discuss it.
Absolutely. Very good. Any other attempt?
We could say, can I make my point?
At a later stage.
Sorry, one by one, please. So maybe Mr. Vanshi. Yeah, go ahead, Mr. Vanshi.
Can we discuss this at a later stage or that manner?
No, somebody has interrupted you. You were saying something and somebody has interrupted you.
So can you give me a moment to complete my...
Can you give me a moment? I heard another answer.
Can I make my point?
Okay, this is Mr. Mohan, because I'm not able to see everybody on this screen.
Yes,
Okay.
yes.
Okay, so you are saying, can I make my point? What is the tone of voice? Of course, it's very firm. It's very clear.
Little aggressive.
Little aggressive. I'm glad that you identified it. So can you please allow me to complete? So you are asking the same thing, but in a more polite way and firm way. So can you please allow me to complete? And when your tone of voice is firm, people are likely to understand that they have actually crossed the limit. Right. For example, in this situation, when people don't work on time and you say, you didn't give me the instructions on time, is there another way of saying the same thing?
Can you please repeat, ma'am, once?
The statement is, you did not give me the instruction on time. So instead of saying this, is there any other way to say the same thing in a more assertive manner?
I'm sorry to say, you didn't give me the instructions on time.
Okay, that's one good attempt.
I would have completed the task if you would have given me enough time.
Okay, again, can you repeat what you said? Because that's an interesting version. I would have completed my task if you had given me the instruction. We are again blaming. The moment there is a blame game, it's a passive aggression.
Can we say like this? I will rather appreciate in case I can be explained properly all the instructions well in time, so that I can complete the work to your satisfaction.
Absolutely right. We could also say, I'm really getting delayed in making the plan of work since I don't have the clear instructions yet. Could you please give me the details at the earliest? So there has to be a clear direction that you're looking for, or clear message that you want to give. Not that you did not give me on time, or you're not giving me on time and that's what is causing delay, but you're giving a clear instruction what you are asking from the other person. Or, for example, in the meeting, sometimes people don't let you present your work. You have done some work you want to present it, but there are others who would dominate and who would not let you do. So in that case, sometimes we say, you don't let me present my work during meetings, maybe during the meeting or after the meeting we say. So is there any other better way of saying the same thing? Try.
It would have been nice if I had more time.
Okay, it would have been nice if I would. Okay, that's a good attempt.
I will rather appreciate if I can be given some time to present my work also.
Absolutely. Again, a positive way of telling it. A positive, because you are not saying you are wrong, but you are requesting that I would appreciate if you let me present myself. So in this example again, this is a second way of doing it. I feel frustrated during meetings with you because I don't get to present my work. So that means you are expressing your feeling in a very honest manner, but respectful manner.
But
I would like to do.
But here you are blaming the other person. I feel frustrated during meeting with you.
See, if you are blaming for something that happened and there is no possibility of correction, it is not helping, then it is passive aggression. But you are clearly telling him that because you don't allow me to present my work, because you want to communicate to that person directly, and then you're also expressing your wish in a very honest manner.
People may not take it nicely, frankly speaking.
They will not take it nicely?
No. If you tell anyone that
maybe can we say?
Okay. So if somebody tells you very honestly that this behavior upsets me, will you not like it? I'm just asking.
No.
No, madam. I think what we need to tell probably is I feel frustrated, during the meetings if I don't get a chance to present my work. I would like to do a complete presentation so that I could provide my inputs. Because in this case, when we are directly saying that, I'm upset because of you, probably that is looking like a more blame. Instead of that, we can say, I feel frustrated if I don't get a chance to present my, deck, whatever it is.
Okay, I think that's another good version where you're not blaming, but you're expressing yourself. Again, a good version, I would say, that you are not saying that you are the reason for me to be frustrated. Yes. You're saying I feel frustrated during meeting when I don't get to present my work. So when with you is probably more direct in blaming the person. I agree, and I would like to do a complete presentation so that I could provide my inputs. I think that's a good input. I'll make a change in this. Thank you. I'll make a change into this. Thank you. So the last one, working in this place is impossible. None of the issues are handled properly and the whole place is falling apart. A lot of time we say this, for our organization when things are really very messed up. So instead of saying like this, is there a better way of saying, expressing your concern for the place?
Simple way that, sir, with these kind of discussions, possibly we are not reaching anywhere. So if all of us can have an open environment, we can contribute to each other to build up the whole system again.
Wonderful. I think that's a good version. So I find it
working in this place would be excellent.
Yeah. Sorry, could you please repeat?
If the issues are handled properly, working in this would be excellent.
Can be, definitely, can be. So this is one more version that I have written here. I find it really difficult working here. I think something needs to be done about the way we handle important issues.
Can we have some other ways out also so that we can make it more easier and get more solutions to work on?
Definitely. See, as long as what you're saying is not blaming anybody, is not disrespectful, not done with the idea to insult or offend somebody, it's perfectly all right. So only thing is the same thing has to be said as not, name calling or putting the blame on one person or making derogatory comments about the organization. It's like taking the responsibility. You can say so. This is just an example. And the idea is to bring this to the mind that means the same thing can be said in a way. A lot of answers actually have come in here. The work culture here needs improvement. Again, Dr. Monga, I think it's all right, but then we are not getting direction to work. We are not moving forward. So that's a good as a comment, but that requires direction, how we need to handle it. Okay, I have solutions, hear me out. Again, Dr. Himanshu, this answer I think you gave to the point where I said you don't allow me to speak in the meeting. So I have solutions. Hear me out is more like a cry. Please hear me. Am I right or wrong? What do you say? Yeah. To me also it appeared to be. Okay. I'll take a little more time, please. Again, when somebody is interrupting, probably I have to be more direct in my approach and saying that I need to be given a chance to speak. This will happen very often in meetings, people who are dominating, who are loud, they would not let you speak. But even if you have a very soft tone of voice, you can still present your thoughts in a very clear manner if you stand to your point. Okay, kindly give instruction in time. Okay, I think these are okay, but we have discussed this, so I'll not take it further. Some of the benefits that I think we can all, just to conclude, we can, go through. There will not be any accumulated anger if you start practicing assertion, because you have been able to honestly say what you wanted to say. Then it would actually improve your relationship with your people, because you are transparent in your approach, and there's nothing that you're keeping to talk at the back of the person. Others take your opinion seriously, because they know you're not going to talk irrelevant things or unnecessary things, or you're not going to blame them or find fault with their way of working. But whatever feedback you will give, they'll take it very seriously. Okay, if this person is saying this, that means there is something I really need to consider. As a result, you will definitely earn respect and credibility in the place where you work, in family, in relationship, because they know you will not speak anything irrelevant. It will also reduce the risk of exploitation and abuse, especially people who are in passive communication. There's a risk of you being exploited and abused. So assertion will help you express your thoughts and exercise your rights also. Life becomes easy and stress-free when you use assertion. This is what is my understanding of assertion. So just the last slide. People, when they come, to communicate, we all select a style of communication. Now I think you will be able to notice yours, notice others also. You don't have control over others' communication style, but by being assertive, you can actually handle even aggressive people. Aggression fuels aggression. Even if the other party is aggressive, but you remain assertive, you'll be able to handle the situation more in a controlled manner. Okay, thank you so much. So this was the presentation I thought we must go through, because this gives a lot of clarity on all aspects of communication. So if I may quickly give you a couple of tips on the actual real assertion when you are doing. So if you remember, we talked about 3 aspects of communication. One is language, second is paralanguage, and third is body language. So if I talk about language, when you are asserting, please check your language. The language throughout the discussion or argument, and even when you are feeling that things are going out of control, it should remain respectful. The moment you will go down on language, the other person will also go down, and then you are not asserting, it's aggression. So very mindfully, you have to keep a check on your language. No derogatory language, no hurtful language, no abuses, no swears. We have to be very, very careful. That's one point. A lot of time when the other person is younger or lower in hierarchy, we have a risk of using tu and tum when we become angry. Please do not do that. Please stick to aap. Especially in English, in Hindi, we know there's a very clear distinction between tu, tum, and aap. Please stick to aap. Do not go down to tu and tum. That's one thing we have to remember. Second is your paralanguage. So in paralanguage, the first thing is your tone of voice. When you're asserting, your tone of voice is friendly but firm. It is not pleading. It is not requesting. It is firm. Then the volume of your voice. The volume of voice has to be normal, regular, the one which we use often or regularly. If your volume of voice is higher, it is not assertion. It is subtle aggression. So please check your volume of voice. Third thing is the speed of speaking. The moment your speed of speaking becomes faster, you may think I'm still asserting, You're not asserting, you are slowly becoming aggressive in your approach. The tone of voice that we were talking about, it should be firm, but it should not be intimidating. It should not be rude. It should not be hurtful or disrespectful. So we have to remember about this aspect. Now coming to the body language. Most important in body language is your eye contact. So when you are asserting, make eye contact with the person whom you are talking to. For example, person X is interrupting me often in my discussion. And I'm looking at person Y and I'm saying, please allow me to complete. Please allow me to complete. You don't allow me to complete. I'm not asserting. I'm just kind of taking out my anger. On the contrary, I look at person X and I say, I have heard you clearly. Please allow me to complete my point of view. That means I'm directing to person X and telling that you are interrupting me. Please allow me to complete. So making eye contact is very important. But at the same time, when you're making eye contact should not be of anger or aggression. A lot of time we communicate non-verbally. Our eyes especially express our inner feeling. So face and eyes are index of your mind. So verbally you are using very good language, tone is fine, but your facial expressions are saying either you are aggressive or you are passive or you are upset or you are sarcastic. So your eye contact should not be full of anger or aggression, should not be intimidating, should not be threatening the other person. Even facial expression need to be either, for a minute, you really need to have a control on your facial expression, but they should not show anger and aggression. In most of the discussion, having friendly face expression is better because that would keep the other person comfortable, would make the other person, stay in the communication. Because even if you have a poker-like face or no expression-like face, that's again not a very good way of, having a dialogue. But having an expression of anger, aggression is absolutely not advisable. Especially when you're handling an important issue, when you have called a person to clarify something or talk about something, please sit and talk. When you sit and talk, the energy to fight goes down. Both the parties should be sitting. When we say eye to eye contact, that means both the parties have to be at the same level. If you are sitting and the other person is standing, you will have to literally bend your neck to talk to that person. Within few minutes, you are going to feel tired and exhausted, and it's going to strain your neck. You are going to get irritable. It's going to actually add to your aggression, and your risk of becoming aggressive is going to be more. On the other side, if you are standing and somebody is sitting and you are talking to that person, you will have to bend down to talk to that person. That's going to be tiring to stand and talk and then also to bend forward. It's always a good idea. If you have gone to somebody's room and somebody is not even asking you to sit down, you may even ask, may I sit down and talk to you? Nothing wrong. Or if somebody has come, even very aggressively, you say, it's okay, I understand you are upset. Please sit down, explain me what you want to say. So you are inviting the person to talk. So half the energy to fight goes down when you make the person sit and talk. Couple of things, if you can remember, when you are having a very, planned assertion, that means it was not something that, happened all of a sudden. Never initiate, a discussion or a talk when either of the parties, either you or the other party, is in hurry, is going somewhere, has come back from somewhere, is busy doing something, is hungry, tired, sleepy, occupied. Assertion will not work at that point because the other person is not right frame of mind. It's always a good idea to signpost, especially if you have some issue to be clarified with somebody. I think we need to talk about it. Tell me when can we sit and talk. So you have signposted that person. And then you select the suitable time. Okay, I think let's meet post lunch. This needs to be discussed. Somebody is asking for leave, or somebody is not regular, or somebody is coming late, or somebody is not completing task on time. Rather than shouting at that person then and there itself, because we get overwhelmed with that, tell that person, I think I'm observing that you have been frequently late for the duty. Let's sit and discuss what is the issue. Can we meet after lunch? and then sit and talk about it. You'll be actually able to get more insight into the situation and resolve the situation. Assertion is a difficult skill, but that's the only healthy skill. Rest all other ways of handling situation are not, healthy and not helpful. Assertion does not mean what you are saying will always be accepted by the other person. I think this is one clarity we need to have. We normally think assertion means I should be able to get what I want. But assertion will give you satisfaction that you voiced your opinion in the right manner. So a lot of time when you assert, the other person may not take your words seriously or may not accept your opinion, but you have alarmed that person that if I keep behaving this behavior, this person is not going to be happy with the way I'm dealing with it. So even with higher ups, with your seniors, we should be able to put across our thoughts and opinions in a legitimate manner. If you're unhappy about something, dissatisfied about something, please communicate, but communicate in a right way rather than later on becoming aggressive or becoming passive aggressive and leaving the place and going away. That's what is assertion. In public dealing with patients, assertion is absolutely a very, very helpful skill, because you will come across people who are aggressive, especially when they are in pain, they are suffering, they are unwell. Their whole frame of mind is very different. Aggression may just be a reaction coming out of their situation. But you being mindful of your communication, you can manage most of these situations very, very, very effectively. But that requires you being very mindful of your way of handling your situations. Any questions about this, whatever we have discussed, before we move further to the next point?
I just wanted to add that the assertion always gives you a sense of satisfaction, even if whatever you say is not fulfilled. You feel you have a good sleep at night that you tried your best. Like I deal in a trust hospital, I'm the medical director, and a lot of times the decisions which I want to convey scientifically may not be acceptable at the other side, because they have to think of a lot of other business and financial things. And we keep on having these agreements, but then I need to put my stand very clearly, even if I know that they don't agree. But daily I keep trying, and ultimately I have that conviction in my mind that one day I will succeed. And even if I don't succeed, at least I am doing justice to my chair.
I think you have really concluded the whole discussion in a very beautiful manner, that in spite of being in such a situation, in such a place, in a position, you are clear about your responsibility of putting across your thoughts in an honest manner. Accepting or not accepting is their choice. At the end, you will not be unhappy with yourself that you did not have the courage to express yourself in the right way. And also, let me tell you, people who have the courage to speak their mind, and if what they're saying is making sense, ultimately that prevails.
Yes.
The person may not accept you there and at that moment, but a point comes when they realize, oh, what you were saying was right. That makes a lot of sense.
Yes.
So you're kind of consolidating your position in the system when you assert. Thank you so much, Dr. Deepak Singh. I think that was a wonderful input.
Thank you.
I think everybody will agree with me. Yeah. So we have a role play and 4 videos to be shown. Videos are just 1.5 minute video. So what do you want to do? Role play first or the videos first? But we can't spend more than 10 minutes each, and then we move on to the presentation.
Videos. Let us have the videos first.
Videos?
Everybody agrees.
Okay. What do others say? Videos?
Yeah, we can go ahead with the video.
Videos. But
Yes,
the videos were about the role play, because if we have done the videos, then role play will be missed.
Then we need to do the role play first.
Role play.
Yeah. Maybe the role play first, and we'll keep it very short. So very quickly, I'll just give you a situation where the patient is in the ICU. It is day 3 of the patient stay in the ICU. Condition is not good. but the family wants to take the patient Lama, maybe to another hospital, could be because of the financial reasons, or could be they are not happy, or maybe all factors, are kind of making them go. So any one of you who would like to be the doctor on duty and handle this situation, the patient party can be, uncooperative because they are made up their mind and they are not, ready to listen. How you handle that situation is something that I want to see. Anybody, although all of you seem to be very seasoned, I'm sure you already have your way of handling such situations in place, but for each one of us there'll be a learning from the situation. So who would take the challenge to handle this situation? Somebody who has not done it earlier. I want everybody to get a chance to do the role play. Dr. Seema, would you be interested?
The doctor or a patient?
No, doctor.
Doctor.
Yeah. So, I mean, you are the resident in the ICU, and I need 2 relatives. Some new one, or Dr. Puneet Gupta, who was an excellent patient. Somebody, who is wanting to play the role of the patient, or somebody who has seen something like this, and you are very, really keen to learn how to handle such patients.
I want to push Dr. Venkatesh to do it.
Okay. Dr. Venkatesh, I'm sure he has a lot of experience handling the situation. So
I've never seen him angry, that's why.
Okay. What do you say, Dr. Venkatesh? I can't hear you. You have to unmute your device if you're speaking. I'm not able to hear you.
I mean, I would have loved to, madam, but then I had a very hectic day today in the hospital. So that's exactly the reason why I joined late. I missed the first 20 minutes of your presentation. Probably some other time, madam. Definitely.
Shall no issue.
Coming, yes. I'll be more
sorry to push you. Sorry.
That's all right. Yeah. So maybe Dr. Praveen Monga, will you be ready to be the patient's attendant? We don't need the patient. It's just the family. Just 2 members. So maybe with you, Mr. Vijay Kumar. Okay, I asked Mr. Vijay Kumar if he's not okay, then maybe Dr. Himanshu. Mr. Vijay Kumar, are you okay?
No, I think Dr. Himanshu can go ahead.
Okay. So Dr. Praveen Monga and Dr. Himanshu Gupta, you are patient's attendant. It's a lady, 58 years old lady with multi-organ failure. Day 3 of the ICU stay. Prognosis is really not very, positive, not good. And you want to take the patient to another hospital. And Dr. Seema is the resident on duty. So do you need any more information, 3 of you, to play the role?
It's okay.
It's okay. So all others can, switch off their video. So what we have to observe, what Dr. Seema does effectively to deal with this situation, or what could have been done differently. And then also the 3 parts that we discussed: language, paralanguage, and body language. So we all will observe and we'll give you a feedback of that. Thank you. So Dr. Venkatesh, if I may ask you to please switch off your video. Is that okay?
Yeah, definitely.
Sure. Thank you. Yes, please go ahead. Yeah. So maybe the family can start the discussion. Yeah, you can start the discussion.
Are you starting or should I start?
Patient party will start.
Yeah, patient party will start. Dr. Monga, aap shuru kariye.
Okay, madam, I want to talk to you regarding a very serious concern. My patient is there in the ICU for last 3 days, and she doesn't have any improvement. We are not satisfied at all with it. But, we want to take her.
Are you really doing anything to the patient?
Yeah. See, your patient is being seen. Yeah, your patient is being seen properly by the consultant.
No, not at all seen with the.
Not at all, ma'am.
No, actually, see, the patient, the doctor has seen it on your patient.
When? Since morning we are here, no doctor has come.
No, he has gone to the OT. Today only he has not come, but he has given us the instructions.
So if the doctor is in OT, then who will look the patient?
he will be coming. We are looking after, and then he has given the instructions. So we are doing
No. This is
accordingly.
not the way. You are keeping the patient in the ICU and the doctor is in OT. If you know the doctor is so busy, then you should have not taken the patient.
Please looking into, please.
Not comfortable.
Yeah, you don't feel that the patient is not being seen. I will explain to you. You can come and sit, and you can come and sit, and then we can discuss about
मैडम अगर आपके पास
the
बैकअप
status
नहीं
of the
है,
patient. Yes.
आपके पास बैकअप नहीं है तो नहीं लीजिए ना पेशेंट, हॉस्पिटल को अलाउ नहीं करना चाहिए अगर आपके पास बैकअप नहीं है तो छुट्टी कीजिए मैडम, हमारी तो छुट्टी कीजिए।
अच्छा, आप ऐसा फील मत कीजिए, आपके पेशेंट को अच्छी तरह से देखा जा रहा है। आप देखिए इनके वाइटल साइंस।
यही तो फील कर रहे हैं मैम कि नहीं देखा जा रहा।
नहीं, आप एक्चुअली आप
ये तो फील
आपको
कर
मैं
रहा, तभी तो
समझा
आपसे बात करने आए हैं।
नहीं, डॉक्टर आएंगे, आपके कंसल्टेंट आएंगे, अच्छी तरह से वो आपको एक्सप्लेन कर
मैडम
देंगे।
कोई
लेकिन
भी
अभी
कोई
जो
भी
चल
नहीं है
रहा है,
यहाँ बताने के लिए, कोई भी नहीं है क्या सिचुएशन है, क्या होने वाला है, क्या लाइन ऑफ ट्रीटमेंट है, कैसे पेशेंट रिकवर होगा, कोई भी कंसर्न एड्रेस करने वाला नहीं है। इसलिए बेटर ये है कि आप हमारे पेशेंट को डिस्चार्ज कर दीजिए, वी विल टेक टू सम अदर हॉस्पिटल। आपके डॉक्टर्स के पास टाइम नहीं है, आप बोलते हैं कि वो आएंगे, ओटी में है। इफ दे आर सो मच ऑक्यूपाइड, देयर इज नो पॉइंट, वी डोंट वांट टू वेस्ट टाइम, लाइफ इज प्रेशियस फॉर आवर पेशेंट।
feel like that. But then if you want to take your patient somewhere else, that's fine, no problem. But then the way, I mean,
Okay, madam,
it
then
is
go
being
ahead.
taken
Please
care of.
arrange for the discharge.
That
It is
we can
fine
do.
with you,
That's
na? So
not
please
an
arrange
issue.
for the discharge.
Yeah, that's
Yes, sir.
not an issue. But then you must not feel that the patient has not been looked after, because the treatment protocol is in this manner only. So इनको ऐसे मतलब ये जो आपके ट्रीटमेंट प्रोटोकॉल के मुताबिक ही सब जा रहे हैं, यहाँ पर आपको
This
मतलब
is
चिंता करने
treatment.
की
This is
जरूरत नहीं है।
the part of treatment protocol, not to see the patient for a whole day.
That's not the thing. It sometimes happens actually. Sometimes there is an emergency patient that they have to take up.
मैडम हम भी वही बोल रहे हैं
So
ना,
that's
अगर आपके पास इतने इमरजेंसीज हैं और आप पेशेंट नहीं प्रॉपरली एलोकेट कर पाते हैं, तो देन जस्ट अलाउ अस टू लीव, बिकॉज आवर पेशेंट इज एलिंग हियर। वी डोंट वांट कि आपके डॉक्टर्स ओटी में रहे और हमारे पेशेंट को तकलीफ हो। आपको हम कैसे मान ले, हम सवेरे से यहाँ पर हैं, कोई भी पेशेंट को देखने नहीं आया, आप बोलते हैं आज इमरजेंसी आ
हम
गया।
लोग हैं, देख रहे हैं, हम लोग हैं, हमारे आईसीयू के डॉक्टर्स
आपने
हैं
तो
जो देख रहे हैं।
बहुत देर बाद सब नर्सेज वगैरह से बातचीत करने के बाद आप आए हैं, आप तो थे ही नहीं यहाँ पे।
एम्बुलेंस आप मंगवाएंगे, हम मंगवाएंगे?
Sorry.
मैडम देखिए, आप तो हंसने लगे हमारी बात पे, हम कितना सीरियस होकर बात कर रहे हैं, आप तो हंस रहे हैं। आपको कंसर्न ही नहीं हमारे पेशेंट से।
डॉक्टर हिमांशु बस कर दो। डॉक्टर सीमा तो बेचारी घबरा गई कि ये क्या हो गया मेरे साथ। She has put me in.
Dr. Seema, sorry, but I just replayed what I have addressed half an hour back.
No, it was all like, in the mind, it's acting, so it was not coming.
देखो, आई थिंक एटलीस्ट ये तो एम्पैथी क्रिएट होनी चाहिए कि जो रेजिडेंट्स भी इसको हैंडल करते हैं उनके लिए भी कितना मुश्किल होता है। एकदम से सामने से जब कोई एग्रेसिव पेशेंट पार्टी आती है, इट्स नॉट इजी टू हैंडल। हम बाद में तो कहते हैं आपको ये बोलना चाहिए था, ये बोलना चाहिए था, बट व्हेन यू आर इन दिस सिचुएशन, अनलेस यू हैव लर्नड एंड थॉरली प्रैक्टिस इट, इट्स वेरी डिफिकल्ट टू टॉक टू द फैमिली बिकॉज़ दे आर वेरी ऑफेंसिव।
This thing happens in the hospital day in and day out. Patient enters the chamber and just stops with plastic.
अभी तो उन्होंने लामा नहीं पूछा, उन्होंने ये नहीं कहा कि लामा साइन करवाना है। असली बात तो ये थी कि लामा साइन करवाना है, वो फैमिली करेगी कि नहीं करेगी। अभी आई एम डूइंग अ प्रोग्राम फॉर रिलायंस फाउंडेशन हॉस्पिटल बॉम्बे, so there we were discussing this situation where they forgot to tell the family that you are taking the patient for home care, which they mutually agreed, both the parties, that you are taking the patient for home care, 85 years old lady and recurrent admission. And then it was felt that this case is not discharge case, this is a LAMA case because the patient is not fully fit to be taken home. And in the end, when they said that you will have to sign LAMA, there was a huge hue and cry about it. And the family said, we are going to take it because you have agreed to send and now you are asking us to sign. So even a small mistake, like for example, when you said the consultant has not seen, that itself was a big issue with both the family members, that why is my patient in the ICU when the consultant has no time to come and see. So we have to be very careful about the words that we use or the information that we share. I think that's a. So Dr. Seema, if I may ask you quickly, what was the feeling when you were doing it? How did you feel?
Yeah, like exactly what to say. I mean, here in these cases, we keep on getting such problems where, you know, the duty doctor.
In this role play, we are talking about the role play. How did it feel to be there, to be the doctor on duty?
Yeah, it's not easy. It's not easy to answer questions on behalf of, you know, what exactly not you are doing. Like, you know, you are dependent on the consultant also for the treatment part of it.
Yeah. So what do you think you did effectively? You have done a lot of good things in the whole, this thing, role play. So
I tried as much as possible to keep the attendants calm so that they don't become aggressive. But then, of course, I also felt that I was not, you know, giving full confidence on what, you know, the treatment part they wanted to know.
Absolutely. So if I may ask the group to tell, what do you think Dr. Seema did effectively? If you could write in the chat box, each one of you, tell what is good. I would like to see what she did well, because it's not easy to be in that place. So yes, I agree. She was very calm. She showed a lot of patience. And then being polite, yes, all through she was very polite. Again, she was very calm. I agree. And she offered seat also. बैठ कर बात करते हैं, बैठ जाइए आप please, है ना? She also waited for them to complete. She did not try to snub them. Extremely polite. Yes, I think that's a better way, I would say. He was extremely polite. So sometimes extremely politeness also is not the right, she was too polite. I think both of you have pointed to the same thing. So there has to be, you know, firmness. There has to be assertion in your communication. Absolutely. She was assertive and defensive. I would, not agree completely with Dr. Rajesh, because assertion requires little more clarity in communication. And that's what we are trying to learn here. So here they were dominating, and somewhere we were on defense. So can we find a way to not to be overwhelmed with their aggression is something that we want to learn. Any other input from anybody? Yes, but she was trying to be very nice, very kind, very polite with them. Again, that does not work. See, I think that's a clear example. When you are extremely polite, very nice, people take you for granted. People start dominating you. They start overpowering you. So that's a good example, Dr. Seema, that your behavior showed that, okay, being extremely nice is also not something that we want to. So why should we be very defensive? No, we should not be defensive. Absolutely no. I would never ask you to be defensive. The moment you are on defense, you have lost the game. Then they are the one who will dictate their terms. You will just be agreeing with. Yeah. So that's not.
I think, but I think here, because the absence of consultant was the point that make these attendants. I mean, they point ko pakad liya, and then they were trying to.
Exactly. That's what I said. That information, when you share and you're not able to handle and you are not able to put the right, defense, you have lost the argument, because now they are dominating and they are now blaming that there's nobody to look after and the patient is not being attended. So that's what, should we be saying this, or is there any other way to talk about it? Something that we need to tell. So let's do the same role play once again. I would be playing the role of Dr. Seema, and both of you will be the attendant, and be as rude as, blunt you were with her, or even little more, if that's okay. Let's see if I can assert and help you come to a point. Is that okay? And please observe some of the things that I do, especially how I build my rapport with the patient's party, how I create familiarity, how I use that to my advantage, and how I'm able to address their concerns. So I think these are the things I want you to look at. Again, look at the language, look at my paralanguage, and look at my body language. That will give you an insight into how we can handle the same situation differently. So if I may ask everyone to please switch off their videos, and just 3 of us be on the screen. We'll keep it very, very short and crisp. So I'm in the ICU and I'm the resident on duty, and both of you are relatives to patient, what should be the name? So Hasini, okay? Patient's name is Suhasini. So, and both of you are her brothers. Is that okay? Both of you are her brothers. Okay. So, आप अंदर आते हैं और मैं आपसे कहती हूँ कि हाँ जी प्रवीण जी, आप सुहासिनी के ब्रदर है ना?
हाँ जी मैडम, आपसे बात करनी थी, बड़ी इंपॉर्टेंट बात करनी थी। 3 दिन से हमारा मरीज आपके आईसीयू में दाखिल है। बिल्कुल
आप अंदर आइए, एक मिनट अंदर आइए, बैठिए, जो बात करनी है जरूर करिए, बैठ के करिए, बैठिए, दोनों बैठ जाइए।
मैडम बैठने का टाइम नहीं है हमारे पास, आप बात सुनिए और बात सुनिए। हमारा मरीज 3 दिन से दाखिल है यहाँ पे, 3 दिन से कोई इम्प्रूवमेंट नहीं है, कोई हमें बता नहीं रहा, कुछ नहीं है। हमें इस मरीज पे हमें लेके जाएंगे जी, और कहीं लेके जाएंगे, छुट्टी कीजिए।
मैडम सवेरे से यहाँ पर आए हुए हैं, देख रहे हैं कुछ ट्रीटमेंट के बारे में कुछ चर्चा नहीं होती है, कुछ बताया नहीं जाता है, कोई है नहीं देखने वाला। डॉक्टर कब आया है कब गया है हमको तो मालूम नहीं। सवेरे से 8 घंटे से तो हम लोग यहाँ पर है, पेशेंट को देख नहीं रहे हैं, ट्रीटमेंट नहीं दे रहे हैं, तो बेटर ये है कि हम पेशेंट को लेके जाते हैं।
ऐसा है, देखिए हिमांशु जी, एक मिनट, ऐसा है कि आप दोनों के पॉइंट्स बहुत वैलिड हैं। अगर एक एक करके हम इसको डिस्कस करेंगे तो मैं आपको बेहतर इंफॉर्मेशन दे पाऊंगी और इसके लिए हम कंक्लूजन निकाल पाएंगे, है ना। लेकिन अगर दोनों चीजें बार बार बोलेंगे तो शायद मैं भी भूल जाऊंगी कि आपका सवाल क्या था और मुझे जवाब क्या देना है। तो ऐसा करते हैं, पहले प्रवीण जी ने जो कहा उसकी बात कर लेते हैं। तो प्रवीण जी, आपने कहा कि आप पेशेंट को लेके जाना चाह रहे हैं क्योंकि आपने कहा कि 3 दिन से पेशेंट की कंडीशन में कोई इंप्रूवमेंट नहीं है ना, और कोई हमें बताता नहीं। हाँ, देखो ऐसा है कि मेरे ख्याल से जिस दिन पेशेंट हमारे पास आई थी तभी भी हमने परिवार के जो लोग थे, आप ही दोनों थे मुझे याद है, क्योंकि हमने आप लोगों को आइडेंटिफाई करा हुआ है क्योंकि आप हर समय ज्यादातर यहाँ होते हैं। तो आपको बड़ा क्लियरली हमने एक्सप्लेन करा था कि पेशेंट की कंडीशन बहुत अच्छी नहीं है, क्योंकि जिस कंडीशन में वो आई है उनको ऑलरेडी अंदर इंटरनल ब्लीडिंग हुई थी, गैस्ट्रिक ब्लीडिंग हुई थी। आपको बताया था कि जब हमने एंडोस्कोपी करी तो अंदर ब्लीडिंग थी उनके उसमें, तो उसमें कंडीशन तो उनकी पहले भी बहुत अच्छी नहीं है, इसी वजह से उनको आईसीयू में रखा गया है। और जहां तक बताने की बात है, दिन में 2 बारी हम फैमिली को बुलाकर जो भी होता है उसको बुलाकर पेशेंट को दिखाते भी हैं और कंडीशन के बारे में बताते भी हैं। ये मेरे पास पेशेंट की केस शीट है। और कल कोई मिस्टर विनोद थे शाम के टाइम में, कल शाम की बात है, कोई आपके रिश्तेदार होंगे या कोई होंगे?
मैडम हम सवेरे से आज की बात कर रहे हैं, अभी डिटोरिएशन डॉक्टर आपके जो भी कोई राउंड पे थे उन्होंने तो कुछ हमें बताया नहीं, कंसल्टेंट आ नहीं रहा है देखने के लिए। जो भी डॉक्टर यहाँ पर है वो रेजिडेंट हैं जिनको ज्यादा डिटेल नहीं मालूम है। नर्स बोलती है डॉक्टर से बात करो, डॉक्टर अवेलेबल नहीं है, तो डिसीजन मेकिंग के लिए हमको तकलीफ हो रहा है ना। आप अगर केयर कर रहे हैं, आपने हमको एक बार डे 1 ट्रीटमेंट प्लान बता दिया, लेकिन उसके आगे क्या है? अभी डॉक्टर अगर बात नहीं करेगा तो हमें डिसीजन मेकिंग कैसे करेंगे? हमारे पेशेंट को डिटोरिएशन दिख रहा है और हमें कोई बताने वाला नहीं है कि आगे लाइन ऑफ ट्रीटमेंट क्या है।
मैडम आप तो आराम से चैम्बर में बैठे हैं, चैम्बर में बैठ के बात कर रहे हैं, वहां पे देखिए मरीजों की हालत क्या है।
मैं हिमांशु जी ने एक बात पूछी, मैं उसका जवाब दूं, फिर मैं आपकी बात सुनती हूँ, जरूर सुनूंगी आपकी बात। जो आप कह रहे हैं आपका पॉइंट बहुत वैलिड होगा, पर मैं सबको एक साथ तो नहीं हैंडल कर पाऊंगी। हिमांशु जी, जैसे आप कह रहे हैं कि देखा नहीं, कंसल्टेंट ने देखा, ऐसा है कि कंसल्टेंट बाई चांस ओटी में है लेकिन उनके साथ हमारा रेगुलर टच बना हुआ है। रेजिडेंट्स जो होते हैं वो 24/7 पेशेंट के पास होते हैं। नर्सेज जो है वो 24/7, आईसीयू का मतलब ही ये है कि पेशेंट को हर वक्त हम मॉनिटर कर रहे होते हैं। और अगर 1% किसी वजह से कंसल्टेंट नहीं आ पाए, जैसे अभी एक इमरजेंसी केस है तो वो नहीं आ पाए, बाकायदा उनके साथ केस डिस्कस करा गया और उनकी गाइडलाइंस के ऊपर जो ट्रीटमेंट चेंज करनी है वो करी गई है। ट्रीटमेंट में देखिए जो भी स्टैंडर्ड ट्रीटमेंट प्रोटोकॉल्स हैं वो हम एग्जैक्टली फॉलो कर रहे हैं। अब आपने कहा आप लेके जाना चाहते हैं, एक मिनट, अलाउ मी टू कंप्लीट। अब आप कह रहे हैं कि आप लेके जाना चाहते हैं, मैं आपसे पूछना चाहूंगी कहाँ लेके जाना चाहते हैं, किस हॉस्पिटल में लेके जाना चाहते हैं?
हम दूसरे हॉस्पिटल में लेके जाना चाहते हैं मैडम, फोर्टिस हॉस्पिटल में लेके जाना चाहते हैं। वहाँ पे हमने डॉक्टर से रिपोर्ट भी शेयर की है, उनका कहना है कि इम्प्रूवमेंट और अच्छे से मिल सकता है, थोड़ा टाइमली ट्रीटमेंट होना चाहिए। हमें ऐसा लग रहा है कि आपके यहाँ वर्कलोड ज्यादा है और डॉक्टर्स की अवेलेबिलिटी थोड़ा टाइमली नहीं हो पाती है। ये आपकी तरफ आप भले केयर करना चाहते हैं, अगर टाइमली नहीं हो पा रहा है केयर तो फिर हमारे लिए ऑप्शन ओपन रहना चाहिए ना मैडम।
नहीं हिमांशु जी, अगर आप पेशेंट को लेके जाना चाहेंगे मैं कभी भी आपको मना नहीं करूंगी, क्योंकि ये आपका अधिकार है, आप लेके जाना चाहेंगे ले जा सकते हैं। मैं सिर्फ 2-3 बातें आपको कहना चाहूंगी जिसको आप ध्यान में रखते हुए डिसीजन लें। तो पहली बात यह है कि जहां तक पेशेंट की ट्रीटमेंट की बात है, बाकायदा हम लोग जो स्टैंडर्ड ट्रीटमेंट प्रोटोकॉल होता है वो फॉलो कर रहे हैं। आप चाहें तो मैं आपको एक समरी बनाकर देने के लिए तैयार हूँ। आप जिस हॉस्पिटल में लेकर जाना चाहते हैं वहां पर जाकर वो समरी दिखा के उनसे पूछिए कि क्या इसके अलावा वो कुछ करेंगे। क्योंकि देखिए अगर हम पेशेंट को यहाँ से मूव करते हैं, पेशेंट की कंडीशन बहुत अच्छी नहीं है, यहाँ से निकाल कर लेके जाना और दूसरे आईसीयू में लेके जाने में जरूरी बता दूं मैं आपको, कम से कम 3-4 घंटे लग जाते हैं पेशेंट को दोबारा सेटल होने में। अगर ये मेरा अपना परिवार का भी कोई व्यक्ति होता, मैं उन्हें इस हालत में मूव करने की सलाह नहीं देती। अगर फिर भी आप लेके जाना चाहें, आप बेशक ले जा सकते हैं, मैं रोकूंगी नहीं, लेकिन इस चीज को ध्यान में रख लीजिए कि अगर ट्रीटमेंट यहाँ भी सेम है और वहां भी सेम है, और दूसरी बात, वहां पे बेड है नहीं है, ये सारा कुछ पहले एक बार कंफर्म करना आपको आपके लिए अच्छा रहेगा। और जहां तक मैं समझती हूँ कि ट्रीटमेंट में कोई कमी नहीं है, अगर आप कहें आपके कोई जानकारी में कोई आपके अपने डॉक्टर हैं, जैसे कई बार फैमिली फिजिशियन होते हैं जिनको आप सारी बात करते हैं, जिनसे सलाह लेते हैं, आप चाहें मेरी उनसे आप बात करवा दीजिए। मैं पेशेंट की कंडीशन के बारे में उनको एक्सप्लेन करने के लिए तैयार हूँ, ताकि आपको एक तसल्ली रहे कि ट्रीटमेंट में कमी नहीं है। हाँ, हो सकता है कि आप जैसे आज कह रहे हैं कि आज सुबह से किसी ने बुलाया नहीं है, क्योंकि कई दफा ऐसा होता है कोई इमरजेंसी ऐसी आ जाती है तो सब लोगों का ध्यान उस तरफ चला जाता है, पर इसका मतलब ये नहीं है कि आपके पेशेंट को कोई नजरअंदाज कर रहा है या उसकी केयर में कोई कमी हो रही है। जो डॉक्टर्स आईसीयू में पोस्टेड हैं, वो डॉक्टर्स कंटिन्यूसली आपके पेशेंट को सुपरवाइज कर रहे हैं, नर्सेज अपना काम कर रही हैं। कंसल्टेंट जैसे ही फ्री होंगे, डेफिनेटली वो सबसे पहले आकर आपके पेशेंट को देखेंगे और आपको बुलाकर वो बात करेंगे। फिर भी अगर आप लेके जाना चाहें, मैं आपको मना नहीं करूंगी, आप सलाह कर लीजिए घर अपने परिवार के लोगों से कि इस हालत में मूव करना कहाँ तक ठीक है। और कंडीशन अच्छी नहीं है, ये तो मैं आपको पहले भी बता रही हूँ और अभी भी मैं ये बता रही हूँ कि कंडीशन बहुत अच्छी
मैडम, हमारी चिंता वही है ना, हमारी भी चिंता यही है कि पेशेंट की कंडीशन अच्छी नहीं है, उस पर डॉक्टर अवेलेबल नहीं है या डॉक्टर ऑक्यूपाइड है, आपके पास वर्कलोड ज्यादा है, तो हमारा ऑप्शन देर से एक्टिवेट करने से अच्छा
तीन
टाइम।
बातें आप कह रहे हैं, तीन बातें आप कह रहे हैं कि कंडीशन अच्छी नहीं है, आपके पास वर्कलोड ज्यादा है और आपके पास स्टाफ कम है। एक चीज से मैं एग्री कर रही हूँ कि कंडीशन अच्छी नहीं है, लेकिन वर्कलोड ज्यादा है नहीं। आईसीयू में जितने पेशेंट्स हैं उसके हिसाब से जितने डॉक्टर्स और नर्सिंग स्टाफ होना चाहिए सब लोग हैं। बाहर कितना भी वर्कलोड हो, लेकिन पेशेंट का केयर में कोई कमी नहीं होती है, और स्टाफ जो ड्यूटी दे रहा है वो आपके पेशेंट को बकायदा दिख रहे हैं। फिर भी अगर आप लेके जाना चाहें, मैं आपको समरी बना देती हूँ, आप एक बार वहां दिखा लीजिए, बात कर लीजिए, और आप अपने परिवार के लोगों से बात करके जो भी आप कहेंगे मैं करने के लिए तैयार।
ठीक है मैडम, आप समरी बना के दे दीजिए, लेट अस।
थैंक यू सो मच, थैंक यू सो मच, थैंक यू। तो कैन आई रिक्वेस्ट एवरीबॉडी टू कम इन।
मैडम, वैसे हॉस्पिटल में हमारे जैसे शरीफ पेशेंट्स के अटेंडेंट होते नहीं है।
आप शरीफ तो नहीं थे, पर आपको मैंने एग्रेसिव होने नहीं
पेशेंट सुनते ही नहीं है, चुप ही नहीं होते, सुनते ही नहीं है। आपको मेरी बात सुन लो, बात नहीं सुननी थी, बात
जब वो बोलते हैं हम भी अपसेट हो जाते हैं। प्रॉब्लम ये, मैंने पहले कहा कि वो तो अपसेट है ही है, फॉर फाइनेंशियल रीजन, फॉर पेशेंट्स लाइफ, उनका कंसर्न पेशेंट की लाइफ होता है। दे थिंक हम केयर नहीं कर रहे, ये उनकी एजम्पशन है। हम कम्युनिकेट नहीं कर रहे तो उनको आइडिया नहीं है कि हम कितनी केयर कर रहे हैं। सो आई ऑलवेज से कीप अपडेटिंग देम, show them what is being done in the patient's care, so that they know enough is being done, everything possible is being done. This is one of the primary needs of the patient's family member, when especially the patient is in critical condition. It's not just doing, it's also letting them know that what is being done. एग्रेसिव वो होंगे, लेकिन अगर आप एग्रेसिव नहीं होंगे, मैंने तो आपसे कहा यू बी एज एग्रेसिव एज यू वांट, आई अलाउड यू टू बी एग्रेसिव। That's what I want to demonstrate, that if you stay calm and assert and put right things in the right perspective, people would usually understand. मैंने तो नहीं कहा कि नहीं होंगी, अभी तो मैंने आपसे ये भी कहना था कि अगर आप लेके जाएंगे तो एक डॉक्यूमेंट साइन करना होता है, वो आपको करना पड़ेगा जब आप लेके जाना चाहते हैं, और वो मैं साइन करवाती आपसे, नहीं तो मैं पेशेंट नहीं भेजती आपका। So see, this comes with practice, with lot of practice, but this is going to be a great helpful skill. तो इसी के ऊपर वो चारों वीडियोस हैं जिसमें मैंने 4 अलग अलग तरीके से इस सिचुएशन को हैंडल करके दिखाया है। तो आई विल क्विकली शो दी वीडियोस टू यू सो दैट ये रह ना जाए, एंड देन वी हैव दी प्रेजेंटेशंस बाय दी पार्टिसिपेंट्स। Yeah, let me see the videos. Okay, so the first video is about the passive communication. Very strange.
This is law of Murphy.
And if you remember, last time also we had a similar challenge. This time I played the videos before I, identified that these videos we're going to see, to make sure that they are working. I think I'll have to download them. So what do you want me to do? Download and show? Give me a second, please. Let's see if I have it. I'll take a minute to see if I have it already in the. No, I don't have the videos. I just download and show. Give me a second, please. So by the time it is downloading, if I may ask, who all are going to present today? One is Mr. Mohan, and second is Dr. Deepak Singla, and who is the third one? Who was supposed to be presenting, by the way? If somebody can check the list and tell me. Anybody has access to the list?
Dr. Rajesh, Dr. Puneet, and Mr. Mohan, it is showing.
Dr. Puneet also was supposed to be presenting today.
No, it is there in the list. His name is sixth session. Sorry, 7th.
Yeah, 7th one.
Yeah.
Dr. Rajesh actually isn't well, so he exchanged with Dr. Deepak Singla. And Dr. Puneet, I think you didn't realize, and even I did not actually follow up with you.
मैम मैम बेड नंबर 7 पे पेशेंट जाने के लिए कह रहे हैं। कहाँ? दूसरा हॉस्पिटल जाने के लिए कह रहे हैं। उनके जो रिश्तेदार हैं। क्या कह रहे हैं? कह रहे हैं मैं डिस्चार्ज कर दूं, दूसरा हॉस्पिटल जाएंगे। वो जो उनका बेटा है, हाँ जी, जो उनके साथ जो है ना, वो कह रहे हैं दूसरा हॉस्पिटल। एक बार आपसे बात करा दो, बात कर लीजिए। जाने दो, क्या करना है, कौन से प्रोफाइल करेगा, छोड़ो करो। डॉक्टर राकेश को बोलो डिस्चार्ज स्लिप बना दे, आप अपना बेस क्लियर कर लेना, ठीक है, बना दो डिस्चार्ज स्लिप, बनवा दो।
So I hope you could see the approach I took in this video. I did not, speak to the patient's family, and I quickly agreed to send the patient. A lot of time we see, our team doing this when the patient family wants to take the patient Lama. We are more than happy to send them, and we don't make any attempt to communicate with them or speak to them or explain to them. So that's often a stand we take. The second is now passive aggressive communication.
मैम आजा, मैम बेड नंबर 7 पे पेशेंट जाने के लिए कह रहे हैं। कहाँ जाना है? दूसरा हॉस्पिटल जाने के लिए कह रहे हैं। कह रहे डिस्चार्ज कर दीजिए, दूसरा हॉस्पिटल। कौन कह रहे हैं? उनका बेटा साथ में जी। वो जो हर टाइम के साथ रहता है। वो है ही बदतमीज, वो बिल्कुल बेकार आदमी है। हर वक्त कुछ ना कुछ उसको नया ही सोचता। अब क्या कह रहा है वो? डिस्चार्ज कर दीजिए, हम दूसरा हॉस्पिटल लेके जाएंगे। तो वहां जाके क्या इनको बहुत बढ़िया कुछ वो मिल जाएगा? क्या यहाँ पे इनको क्या तकलीफ है? क्या कह रहे हैं यहाँ पे, क्या दिक्कत है उसको? कह रहे हैं बस हमारे डिस्चार्ज कर दीजिए, हम दूसरे हॉस्पिटल जाएंगे। नहीं तो वहां पे क्या, यहाँ पे इसको क्या दिक्कत आ रही है, कुछ बता रहा है कि क्या क्या प्रॉब्लम है उसको? नहीं, ऐसा तो कुछ बताया नहीं, कुछ बोला नहीं। अरे ये शुरू से ही ऐसे ही बोल रहा है, ये महा तंग करने वाला बंदा है, किसी काम का नहीं है। भेजो, ऐसे बंदे से क्या करना है हमने, और लड़ाई करेगा, जितनी देर ये यहाँ रहेगा तंग ही करेगा। कभी मेरे पास आता है, कभी कहती है सिस्टर ऐसे कर रही है, कभी कहते हैं जी सिस्टर वैसे कर रही है, कभी कहते हैं जी पर्दे नहीं ठीक यहाँ पे, कभी कहते हैं जी एसी नहीं काम कर रहा आपका, बार बार कंप्लेन ही करते हैं। भेजो इसको, डॉक्टर राकेश को बोलो इसकी वो बना दे। बात कर लीजिए, क्या बात करनी है, बदतमीज आदमी है, जाने जान छूटेगी, कुछ बोलना मत उसको। उसको कह रहे हैं ठीक है हम बना के देंगे। डॉक्टर राकेश को बोलो उसकी डिस्चार्ज स्लिप बना दे और बिल क्लियर कर देना अपने। ये जो जाने दो, ऐसे लोग जाए ना ही रहे तो अच्छा, सारा दिन से खपाई करनी पड़ती है लोगों से, ठीक है। तुम्हारा क्यों मुंह उतर गया? जाओ जाओ जाओ, जाने दो।
So this was passive aggressive communication, where again I did not speak to the patient's family, but then I was talking ill about the family. Now let me quickly look for the aggressive communication. Yes, there we are.
मैम आसो, मैम बेड नंबर 7 पे पेशेंट जाने के लिए कह रहे हैं। क्यों?
डिस्चार्ज मांग रहे हैं, फिर हमें छुट्टी करके हम दूसरे हॉस्पिटल जाएंगे।
फिर क्या तकलीफ है उसको?
वो कह रहे छुट्टी करता हूँ, मैं दूसरे हॉस्पिटल जाऊंगी।
यार बहुत ही पागल आदमी है, हालत पेशेंट की इतनी खराब है, छुट्टी करो, रास्ते में कुछ हो गया तो क्या करेंगे?
उनके साथ जो अटेंडेंट है वो कह रहे हैं कि हमारे डिस्चार्ज होना,
उसका जो बेटा है जो उसके साथ हमेशा बैठता है, बहुत ही बेकार आदमी है। जब देखो इसको, पहले तो इतने नखरे इतने हैं, कभी एसी काम नहीं कर रहा, कभी ये नहीं काम कर रहा, अब छुट्टी कर दो, छुट्टी कर दो।
आपकी बात कराते हैं,
भेजो उसको, जरा सही करो उसको, भेजो जरा। क्या तकलीफ है भाई, क्या हुआ है?
मैम डिस्चार्ज कर दीजिए।
तुम्हें उनकी हालत पता है इस वक्त क्या है?
बहुत दूर पड़ता है, आने जाने में दिक्कत होती है, इसलिए आप डिस्चार्ज कर दीजिए।
मैं तो हॉस्पिटल तुम्हारे घर के पास ले जाऊं, डिस्चार्ज कर दो। उनकी हालत इतनी खराब है, रास्ते में कुछ हो हवा गया ना इधर के रहोगे ना उधर के रहोगे, ज्यादा दिमाग मत चलाओ अपना। इलाज करवाना है तो शांति से करवाना चाहिए, ऐसे नहीं कि इधर भागो उधर भागो।
मैम इधर आने के लिए घर से लगता है, और इधर आते भी बहुत ज्यादा भीड़ हो गया मैम, तो पैसे है नहीं हमारे पास।
तो पहले ही सरकारी में चले जाना था, यहाँ आने की क्या जरूरत थी? आधा अधूरा इलाज करके अब जहाँ जाओगे तो वो लोग तो कहेंगे ना कि ठीक से इलाज नहीं करा उन्होंने, मेरा भी नाम खराब करोगे, और रास्ते में पेशेंट को कुछ हो गया तो और मुसीबत हो जाएगी।
मैम आप डिस्चार्ज कर दीजिए।
भैया बहुत ही बेकार आदमी हो तुम तो। डिस्चार्ज तो मैं कर दूंगी, पर दोबारा मुड़ के मेरे पास बताना, ये कोई तरीका नहीं है इलाज कराने का। अपने पेशेंट का भी नुकसान करेगा और मेरा भी नुकसान करोगे साथ ही साथ में। हमारा आदमी है। सिस्टर,
हाँ जी,
इनकी डिस्चार्ज स्लिप बना दो और बिल क्लियर करो इनका, तब भेजना इनको। जाओ, और दोबारा मुड़ के मत आना मेरे क्लिनिक में।
And the final one.
राजा इसमें मैम मेरा नंबर फैसिलिटेशन जाने के लिए क्या है?
कहाँ जाना चाह रही है?
दूसरा हॉस्पिटल।
छुट्टी के लिए कह रहे हैं?
हाँ जी।
जो उसका बेटा जो साथ में वही होता है उसका। भेजो उसको, मैं एक बार उससे बात करती हूँ। नाम है ना आपका? आप उनके बेटे हैं जी। क्या हुआ इधर?
जी मैम डिस्चार्ज कर दीजिए।
कहाँ ले जाना चाहती है?
जी मैम किसी दूसरे हॉस्पिटल में जाने जो अपने घर के पास में होगा, वहाँ से आने में बहुत दूर पड़ता है, और जो पैसा होता है आने जाने में खर्चा बहुत हो जाता है।
देखो बेटा, अगर आप कहोगे छुट्टी कर दो मैं कर दूंगी, मुझे कोई दिक्कत नहीं। तो मैं आपको ये बताना चाहती हूँ कि इस वक्त उनकी हालत जो है वो लेके जाने वाली नहीं है। क्योंकि एक तो जैसे यहाँ से अगर आप लेके जाओगे तो रास्ते में एम्बुलेंस में लेके जाओगे तो कैसे होगा कुछ नहीं कह सकते, क्या सिचुएशन होगी कुछ नहीं कह सकते। मतलब हालत इतनी अच्छी नहीं है, ठीक है। थोड़ी भी ठीक होती तो मैं कहती चलो ले जाओ, कोई बात नहीं। तो एक तो सबसे बड़ी बात ये है। दूसरा ये देखो बेटा, जैसे पिछले हफ्ते से हम लोग इलाज कर रहे हैं तो हमें काफी हद तक उनके बारे में पता है क्या उनकी कंडीशन है। अब नए हॉस्पिटल जाओगे, नए सिरे से कोई इलाज करेंगे, मैं बेशक तुम्हें पर्ची बना के दूंगी, उनका सारा डिस्चार्ज लिख के दूंगी, जो जो ट्रीटमेंट है। तो फिर भी एक होता है, एक डॉक्टर जो ट्रीट कर रहे होते हैं उनको पता होता है कि इस वक्त इनकी किस दवाई से इनको फायदा हो रहा है, क्या इनको नहीं सूट कर रहा। नई जगह जाओगे तो फिर वो नए तरीके से सारा हैंडल करेंगे। तो देखो एडवाइजेबल तो नहीं होता बार बार डॉक्टर चेंज करना। और मुझे ऐसा भी लग रहा है कि पिछले 2-3 दिनों में थोड़ी, अगर आपने नोट करा तो उनकी कंडीशन में इम्प्रूवमेंट भी हुई है ना?
इम्प्रूवमेंट तो हुई, बट पैसे वाली प्रॉब्लम आ जाती है। पैसे
देखो बच्चे, ये तो मैं मानती हूँ कि प्राइवेट में तो खर्चा आता है, अगर जहाँ भी लेके जाओगे वहां भी खर्चा तो आएगा ही आएगा, ऐसा तो है नहीं कोई फ्री में हो जाएगा। अच्छा, सरकारी में अगर जाओगे तो वहां पे आपको पता है वहां पे इतना पेशेंट होता है कि आपके पेशेंट को बेड मिलेगा नहीं मिलेगा कुछ गारंटी नहीं है ना। देखो मेरे से पूछोगे अगर तो 2-3 दिन की बात और है, जहाँ इतना सह लिया ये भी आप कर लो। बहुत मुश्किल है, अगर लेके जाना चाहते हो फिर तो बेटा मैं जिद तो नहीं कर सकती तुम्हारे साथ, तुम्हारा पेशेंट है, तुम्हारी फादर है, तुम्हें डिसाइड करना है कि क्या करना है। जो भी करना चाहते तुम कर सकते हो। मैं कहूंगी ये कि घर पे एक बार सलाह करो, अपने बाकी जो लोग हैं उनसे बैठ के सलाह कर लो। मेरा कहना ये कि 2-3 दिन की बात और है, हफ्ता निकल गया तो 2-3 दिन की बात है। फिर भी कहोगे तो मैं कर दूंगी छुट्टी, मुझे कोई दिक्कत नहीं, मैं पर्ची बना दूंगी, पता कर लो जहाँ बेड है, जहाँ खर्चा कम आता है, फिर जाने ले जाओ।
जी हाँ, वैसे आपने सही कहा, वैसे एक बार जाके घर में मैं डिस्कस कर लेता हूँ मैम, और पता करता हूँ कि 2-3 दिन की और बात है, और इम्प्रूवमेंट भी अच्छा हो रहा है उनका, तो शायद हो सकता है कि खर्चे थोड़ा एडजस्ट कर लेंगे तो हो सकता है सही हो।
देखो बेटा, हॉस्पिटल में खर्चा तो होता ही है, ये तो है नहीं कि फ्री कहीं काम होगा। वहाँ सरकारी में जाओगे तो वहाँ टाइम ज्यादा लगेगा या बेड नहीं मिलेगा, प्राइवेट में जाओगे तो 19-20 का फर्क आएगा, ऐसा नहीं क्योंकि जमीन आसमान का अंतर। फिर भी आप सलाह कर लो, मुझे बता दें, ठीक है?
थैंक यू।
अच्छा,
so the idea was just to give you the perspective of 4 different styles in the same situation, how we all handle. I hope you got the feel of all 4 styles. So this is about assertion, and of course we'll be discussing it in the future sessions also in more detail about assertion. Any questions about this before we wind up this session? So if there are no questions, I'll just quickly post the feedback form in the group, and I request you to complete the feedback before we have the presentation by Dr. Deepak Singla first, and then Mr. Mohan. Give me 1 second to post the feedback form. Yes, I've shared the feedback form with all of you.
So 1 to 5 andre 5 is best, is it?
Yeah, that's right. So I would request everyone to complete quickly. I've received 12 responses as of now, waiting for others to complete. So meanwhile, I think Dr. Deepak Singla, you can please start your session. I think I need to give you the rights to share the screen. Give me 1 second. Yes. Yes.
Should I start, ma'am?
Yes, please go ahead. Yeah.
Yeah. Greetings from Dr. Singla. Thank you, ma'am, for giving me the chance. And am I audible to everyone?
Yes, you're audible and your screen is also visible to us.
Okay. Thank you very much. I think the screen is quite blank, so anybody may not be able to see anything. So we are just taking you for some time. Just listen to me. So I had discussion with Madam Indu, and our batch has really done very nicely. So she has decided to hold the next 2 sessions at Pangong Valley in Leh Ladakh. The only condition is attendance is compulsory, and those who miss the session will sponsor all others, because missing this complimentary trip means they have a lot of better things in business to do. And we have already spent 2 mesmerizing days at Leh for acclimatization as per the government guidelines. May I request everyone to keep their mobiles off and just listen to the sounds of the bell. Just focus and take deep breathing, and remember seeing that movie 3 Idiots, and try to think and visualize that you are in that valley where you are able to see nice lake. Keep inhaling deeply and exhaling slowly, and feel the fresh air going in and out. Keep a focus on the sounds of bell, and imagine we are all traveling in the bus. We are seeing mountains and rivers and lush green trees all around us. Oh, that's great. We have seen one big ice stupa also on the way. And now we have reached Pangong Valley, and we are at the school of Sonam Wangchuk of 3 Idiots fame. And immerse yourself in the natural scenic beauty of Ladakh. Okay, can we discuss now in the chat box your experience? Hello, can I request all of you to write down in the chat box? Could you visualize something in the last 1 or 2 minutes? And I can't see the chat box myself. Okay.
Is it?
Yeah, no. Thank you, Dr. Praveen. Great. Dr. Mohan, Dr. Vanshi. So these were the ice stupas we were discussing. And this is the Pangong Valley. I was trying to take you there. Thanks to Dr. Indu ma'am, that all of us could enjoy all these things. This was the valley, and these are the camels for which this is known as, and this is the school. I'm sure all of us can remember the school. So, like what we are going to discuss today, can anyone say what was the whole exercise about? What was the aim of this whole exercise? Thank you, Dr. Himanshu. I think I owe a trip now.
Or you owe me a trip now.
Yes. I think the whole batch owes a trip to you.
I know.
So, can anyone summarize in the chat box what was this experience which we recreated, though it may not be the most professional one? It was the first time I was doing it. Yes, thank you, Dr. Parveen. So it was a creative visualization. And as actually I selected the topic, I did not realize, I did not know. Initially, I thought I'm dealing with data visualization, so I was very happy about it. But then when I read into it, I realized it is not what I thought. So because time is little less, so we'll just go to the slides. And actually what I saw was that though we may not be doing it, but we practice it very often. Like when the COVID came, we started visualizing all our ICUs, our isolation. So it was not something which is, we all practice it inadvertently without knowing. It is a powerful technique of focusing and targeting our minds towards what we want. Ultimately, whatever we wish, we become that only. I remember in older times, the mothers always to say that never ever say wrong thing for your children, because sometimes your wishes may come true. So Shakti Gwen, he said that we always attract into our lives whatever we think. If we keep thinking bad things will happen. If we keep thinking good things will happen to us. And Aristotle also said, like, first of all, we need to have a clear goal. Then we need to have the necessary means. And third, adjust all your means to that end. That is the most important thing. Like, we will never get the best means, but we have to see whatever the available means are there. And Muhammad Ali said that if my mind can conceive it, my heart can believe it, then I can achieve it. I think all of us have to believe this. Arnold also said the same, that he had a clear vision, and most of the winners, they have a clear vision that this is what they are going to achieve, and they keep pursuing. They make sure that they have the faith in the route and the path, and ultimately they win. Sometimes if your goal is monetary, there is no harm in giving yourself some kind of an incentive. Like Jim Carrey, he issued himself a $10 million check dated 10 years in future, and ultimately he achieved it. So all these techniques are there. We need to have a quiet space. We need to pursue our goals. And this definitely helps in our experiential learning, which is a philosophy and methodology in which educators purposefully engage with students in direct experience and focused reflection in order to increase knowledge, develop skills, and clarify values. And these are the phases of experiencing learning. First of all, by doing something, we experience, then we reflect by sharing and understanding reviewing the process, then we apply, and that is how we become perfect in doing all these things. Thanks for kind attention, and I will be open in case I can contribute any other questions. Thank you very much. Ma'am, I hope I kept my time.
Definitely. Thank you so much, Dr. Deepak. Yes, thank you. Thank you. So if you could stop sharing, we could have just one or two questions around it.
How do I stop
if I may,
I will close down my PowerPoint.
Yeah, that's okay. You're done.
Yeah.
Thank you. So if I may ask the participants, in your training programs or in your, even training your staff in any way, where can you use visualization or creative visualization in the training program? Because basically what we are learning is with the purpose to use it in your work situation. So of course, for personal growth, for personal development, Dr. Deepak Singla has said that we can use it for our personal growth and setting targets and achieving it. But in training programs, if I ask you to use this pedagogy, write in the chat box, where all can we use this? Can you think of some situations where you can use visualization or creative visualization? Okay, goal setting, yes.
While training our people.
While training our people, but in that exactly what do you want to focus on? What particular topic where you can use this?
The same way what we have done role plays, we can make them understand how the patient feels, and we should also be there in their shoes to make to understand from the patient's point of view, and as well as from the management point of view, from the hospital point of view, how things can be related to each other.
Absolutely. So if you remember, we did an activity called process mapping when we did understanding patients' expectations. So there I used the same technique with all of you. I took you to your hospital OPD and I made you visualize everything which was already there, but then you were seeing with your biological eyes. I made you look at it from the eyes of your mind. So you got to see it closely in a more objective manner. That's one area where you want to focus the attention of the person or the team. You can use this. Also, if you want to really help people learn empathy, that's again where you can use creative visualization, where you can take the patient to the your healthcare providers, to that particular patient's position, and look at that situation from the patient's point of view. So people will be able to understand the perspective of the patients and their family members, or asking them to visualize the corridors or the waiting areas at night time, so they are able to kind of imagine what must be the plight of patients and their family members. Any other idea where we can use this? Handling the situation by visualizing. Yes, if you visualize that I can handle it, I can do it. So as one of the quote was, if your mind can conceive it, if your heart believes it, you can definitely do it. So thank you so much, Dr. Deepak Singla. I think it was very well done, very beautifully.
Thank you.
I wish that happens. So we have visualized it now, and we are just hoping that this actually happens, that we all are able to go together to Leh Ladakh. If not for a very long time, maybe 2-3 days, if not for a very long time. Thank you. Thank you. Yeah. So if I may request Mr. Mohan now to make his presentation, and you can share the screen if whenever you want to do it. Yes.
Yeah, is my screen visible?
Yeah.
No, not yet.
Yes. You are visible.
Not the screen. Yes, now it's going to be shown. Yeah.
Yeah, good evening, everybody. Thank you for staying back at least when I started. It's quite late now. Thank you, Dr. Indu. The topic assigned to me is interesting activity on listening skills. An activity of this kind has already been done by Dr. Indu, and I'm going to make an effort to do it again and make it as interesting as possible. I would request Dr. Indu to keep about 3 people in the waiting room so that I can start the activity. I want it to be an impromptu, so I won't tell them what this activity is about. Otherwise, they are going to become very objective about the activity. So may I request Dr. Indu to keep about put 3 people into the waiting room? Is that too much, or just 2 people will do?
I think 3 people should be okay.
Yes.
2 people should be okay. So I
would like 4 volunteers, please.
Yeah. So I'm putting Mr. Mohan, Vanshi Mohan, in the waiting room. Then I'm sending Dr. Whose name is for next? Dr. Seema, is that okay if I send you to the waiting area? Okay, there you go. And then Dr. Rakshita, are you there? Dr. Rakshita, are you there? Dr. Shahrukh, are you there? Okay. So, Dr. Praveen, is it okay if I send you to the waiting area? So I've sent 3 people in the waiting area. Yes,
Yeah,
please.
one volunteer to take my, I would like to narrate a story or share an episode.
So anybody who is interested to play the role. Anybody, please volunteer. So maybe Dr. Himanshu, if you're comfortable, or Shipra, anybody, Shipra, yeah.
Okay, ma'am.
Am I
Yes,
audible?
thank you.
Yeah, Dr. Shipra? Ma'am, who has volunteered?
There is some challenge. Shipra, there is some challenge in audio at your side. So you'll have to mute. I think we have to take somebody else. Otherwise, we will not be able to continue the activity. Let Dr. Himanshu do it. Yeah.
Dr. Himanshu, am I audible?
Yes, very much.
Yeah, thank you for volunteering, first of all. I'm going to give you a clinical scenario. Please listen to me carefully. I'm also going to display it on the screen. I would like you to read it. And after you have done, you will have to call one of the people from the waiting room and recollect whatever I have shared with you and reproduce it to the person walking out of the waiting room. Am I audible? Can you see the screen? Yes. A young man, 21 years old, underwent removal of calcific growth at the junction of 3rd and 4th ribs by the cardiothoracic surgeon this morning. Is in general ward, bed number 45. Is complaining of numbness down below his nipples. Surgeon has left for the day. Telephonically advised to refer patient to neurologist on urgent basis for further management. Contact neurologist now. Do you want me to repeat it again? A young man, 21 years old, underwent removal of calcific tumor at junction of 3rd and 4th ribs by cardiothoracic surgeon this morning, is in general ward, bed number 45, is complaining of numbness down below his nipples. Surgeon has left for the day, telephonically advised to refer patient to neurologist on urgent basis. For further management, contact neurologist now. Please pass on this information that I just read out to you to the person walking out of the waiting room.
So I'm admitting Dr. Monga. Once he comes in, then Dr. Himanshu, you can speak to him. Dr. Himanshu, you can go ahead.
Dr. Monga, good evening.
Is Dr. Monga there?
Yes, I'm.
Dr. Himanshu has some information for you. He will share it with you, Dr. Monga.
Yes, please.
And
yes,
you are
Dr.
supposed to
Himanshu.
share that information to the next person in the waiting.
Dr. Monga, one patient, 21 years old, got operated today by cardiac surgeon. He is in general ward on bed number 45. He is having some numbness near his nipples. And I have talked to the cardiac surgeon and he has told to give a call to neurologist.
Thank you, Dr. Himanshu. Ma'am, could you please invite the next person now to the waiting room?
Yeah, I've admitted Dr. Seema.
Dr. Monga, please share this information with Dr. Seema.
Sure.
Dr. Seema?
Yes,
Dr.
I can
Seema?
hear. Yes.
Yeah, Dr. Monga has some information for you. Please listen to him.
Okay.
And you will have to transmit this information to the next person in the waiting room.
Okay.
Dr. Seema, there is a patient around 21 years old, admitted in general ward, bed number 45. She was operated by cardiac surgeon, and she has complained of numbness near her nipples, and cardiac surgeon was informed. He has asked for a referral for a neurologist referral.
Ma'am, could you please invite the next person from the waiting room? Dr. Seema, you will have to transmit this information to the next person walking out of the waiting room.
Okay.
So I've admitted Mr. Vanshiman. So Dr. Seema, you have to communicate to him.
Okay. I'll communicate now.
Yes, yes, please go ahead.
Okay. Okay, there is a patient, 20 years old. He's admitted in
Is Mr. Vanshiman there?
He's there.
Mr. Vanshi?
Yeah, I am here. I'm sorry.
Yeah, Dr. Seema has some information for you. Please listen to her and you will have to reproduce that information for all of us.
Yeah. Can I?
Yeah, go ahead, Dr. Seema.
Okay. So there is a patient, 20 years old, is admitted in the general ward in bed number 45, and he has been operated by a cardiac surgeon. Now he's complaining of numbness near her nipple, and a referral has been given to the neurologist. I think that much only.
Yeah. Dr. Vamshi, can you please repeat what information was shared by Dr. Seema with all of us?
Yeah, there's a patient admitted in general ward on bed number 45, and patient is a cardiac patient with numbness.
Anything else?
I think
don't worry.
They have an opinion with the neurologist or something.
Okay. Anything else? Thank you, Dr. Thank you, Mr. Vamshi. Thank you. So thank you, friends. Thank you for all the cooperation that you have extended. So now you have heard what Mr. Vamshi Mohan has shared with us. This information has been transmitted through 4 people. So I will now display on the screen as to what the original information was that I shared with Dr. Himanshu. Here it goes on the screen. This was the information that I had shared with Dr. Himanshu. A young man, 21 years old, underwent removal of calcific tumor at junction of 3rd and 4th ribs by cardiothoracic surgeon this morning. Is in general ward, bed number 45. Is complaining of numbness down below his nipples. Surgeon has left for the day. Telephonically advised to refer patient to neurologist on urgent basis for further management. Contact neurologist now. So this was the information that I had shared initially. So what came out from this information that went through 4 people was patient is admitted in general ward, bed number 45. Patient is cardiac patient with numbness. Please get opinion from neurologist. Ultimately, it boiled down to this information. So this is what happens if one does not listen to the communication given to him or her. So this activity explains the importance of listening. So this is popularly called the telephone game to emphasize on the importance of listening skills. I will take you people to the result of this unfortunate incident. This is a real life experience that I had about 15, 16 years ago. This is similar to the very popular medical legal case in which the Supreme Court awarded one of the highest compensations in the country. If you will remember, Nizam's Institute of Medical Sciences, Hyderabad, versus Prashant Dhananka. So the seriousness of this situation was lost in transit as the information got corrupted. The neurologist came to see the patient only on the next day, about 16 hours after the first complaint of numbness. A laminectomy surgery should have been conducted within 2 to 3 hours of the first complaint of numbness. This was not done, and the patient suffered irreversible paraplegia and had to be compensated by the hospital. So the initial information that I had shared was this, and ultimately, this information as it was transmitted through 4 people was corrupted, and it came out that the patient was a cardiac patient and had numbness. The actual clinical complaints of the patient and the condition of the patient was now not forthcoming after it went through 4 people. And the urgency of the situation, if you can see, I have 2 places mentioned about the urgency. That is telephonically advised to refer the patient to neurologist on urgent basis. And also the information also says contact neurologist now. So this, the essence of the urgency was lost in the hospital, and the hospital was ultimately liable to pay a compensation to the patient. So this activity explains the importance of the emphasis on the listening experience. So this activity, the advantages of this activity is it's a fun activity for everyone to enjoy without there being any perceived loser. Helps people to listen to each other more intently, helps improve listening skills. This activity can be done both online and offline. In small groups, you can ensure no one is excluded. The further advantages is that this can be played involving people who are educated, uneducated, and even illiterate trainees. This is easy to play. It is quickly started. No materials are required. It's an effective team building exercise. It improves working memory and cognitive abilities, builds social skills like patience and fair play. Now, the disadvantages of this activities are it is not mentally stimulating. It is not possible to include all members in a large group, and excluded members may not like it. The game excludes people with hearing and speaking difficulties. Now, the do's and don'ts of this activity should be that it should be gender neutral. You cannot pitch a male against a female, or in a similar way, don't bring about anything of communal in nature, like put parties on a story carrying 2 different people from 2 different communal backgrounds. It is important not to tell them why you are doing this exercise, as they become more objective while participating and the fun quotient may be compromised. Use unfamiliar phrases and words, numbers and statistics so that the game isn't too easy. Go easy on people who struggle with words and phrases. Thank you.
Thank you so much, Mr. Mohan. Thank you.
Thank you. Thank you. So,
you could stop sharing.
Yes, ma'am.
Thank you.
So now we have seen how the essence of the important aspects of this particular communication that were shared with the first person was lost in transit, and it led to a catastrophe. So it is important for people in the healthcare industry to develop good listening skills, so that the information that they gather during their clinical practice is adequately transmitted, and there is no act of negligence or deficiency in services, and the quality of patient care improves in the hospital.
Absolutely.
Thank you.
Thank you.
Is there any questions that I can take?
So one comment that I can make, what brings seriousness to this activity is the real life case that you have taken to, do this activity. I think that would really remind people to be more alert and careful when they are, sharing some important information about patient, and how their care gets compromised when we don't communicate effectively. I think that's the beauty of your activity, that you picked the real life case. Yeah.
Ma'am, one thing I wanted to share, this was during my, I think initial, I had about 5-6 years of experience as an advocate, and this patient was actually wheeled into the courtroom, and it formed a big impact on the judge's mind. And what was very interesting about this case was that the nurses wrote notes repeatedly said, contact neurologist, neurologist not available, neurologist picked up the phone, neurologist asked to call later, neurologist said he'll come tomorrow. But nobody actually saw this. The complainant's lawyer did not focus on the nurse's notes. You know, then the judge asked me to intervene, and he said, why don't you try and find, you know, some solution to this? Then I had to point out to the management and tell them that there is a real concern here with regard to loss of communication. And we had to settle the case out of court and then report the settlement to court. So, see, it's a very bad thing to see a young boy, 21 years old, being wheeled into the courtroom. And this could have been avoided. You know, he has gone into an irreversible situation, and he probably still continues to live like that. Thank you.
Just a question.
Yes, ma'am.
Yeah, like, you know, while during this listening, I mean, this process, noting is a part of it. Noting. Yeah, noting down while, you know, someone is communicating to the other person. I mean, is it a part of it?
The participants during the activity?
No, not during this activity. In an actual thing. Yeah,
yes,
it should be a part of it.
You have to capture the essence of the episode in the clinic, and that must be documented both in the both by the duty doctor and the nurse's record. You know, they just scribbled, went on saying neurologist not responding, but they didn't say as to why the neurologist has to be called, because the people simply didn't have time to go through the entire case sheet and find out the history of the patient. And the surgery was conducted sometime around 2:30 in the afternoon, and the patient complained of numbness at about 4:30, 5 o'clock. And then the shift of the nurses changed at around 7:38, and there was a new batch of nurses who took over. And then, you know, everything was lost in transit. And the neurologist came only on the next day at around 11:30, 12 o'clock. And by then the damage had been done. Apparently what had happened was the gel used during the surgery to absorb blood, one of the particles from that gel had probably migrated into his bloodstream and gone and impacted in his spinal cord area. They had to conduct a surgery called a laminectomy to excise that particle and relieve that pressure on the spine. So if that surgery is not conducted within that 2-3 hours, it's as good as gone. That window of opportunity is gone forever. Thank you.
Thank you so much. Thank you.
Thank you.
I think Shipra wants to say something. Shipra, you have something to say? Actually, Shipra, there is a major challenge at your end, so audio we are not able to hear.
You could probably switch off your video and use only the audio.
No, I think she's saying that she has put her question in the chat.
Yeah, she's written in the chat box one question: being a patient or family, how would we know that the medical negligence has been done?
You would actually know by the conduct of the caregivers, the way they communicate, which is why we are all here participating in this activity. Because and of course, after going back home, one will have the opportunity to go through the case sheet or consult a professional, take the advice of another doctor, a lawyer who would be able to point out these aspects. But there is no replacement to proper communication with the patient. I think that's the biggest the quality that a clinician must develop.
So Shipra, one of the things that patient and the family observes is how promptly are their complaints addressed. In case the patient is complaining of pain or numbness or bleeding or whatever, or dizziness, how promptly are we attending? So even if that was bound to happen, but had the team acted in time and had the consultant visited and had even the surgery been done, if in spite of that, if he had this situation, probably he would have believed that, okay, this was part of recovery or part of complication or part of treatment. But clearly when they say that the call has been sent and nobody has come to see, so it's something that they don't need to get any record of, but they need to, they're there with the patient and they know patient has not been attended. And I think much more than that, the common assumption that we have that we are not very prompt in our action. As a family and a patient, we assume that the healthcare providers are not very prompt, not very careful and care. And that's true also to some extent. We can't deny that fact. A lot of information gets lost in that process. And that's why we have more and more cases, on legal front. Yeah. So thank you so much. I think, Dr. Shipra, that was
one last thing.
Yeah.
See,
yeah, please.
The issue is for the patient's family, he's the only patient. For the caregivers, he's one among the 10, he's one among the 100.
Yeah.
That is something that doctors and caregivers must remember.
Yeah.
Thank you.
Thank you so much. Yeah.
Thank you.
So thank you so much, Mr. Mohan. I think though we did the Chinese whisper once again, but it was interesting.
I'm also fagged out for the day. Like I was traveling and I got back to Bangalore. Thank you. Thank you. Thank you.
Thank you so much.
I hope to do better. Actually, I had hoped to do better.
No, I think you have done a good job, and all of you actually are participating. So I really appreciate your efforts.
Thank you for staying back so late. Thank you.
Yeah, that's what I'm saying. In spite of your busy schedule of being occupied, you're up till 11 o'clock. So that's a huge thing, for everyone. So thank you so much. I will not, delay closure of this session, and let's meet in the next class. Thank you so much. Bye-bye.